Hola, hola, buenos días, ¿cómo estamos? Tardes, pero seguros, eso sí. Bienvenidos, welcome everyone to the 2025 Latin and Indigenous Health Policy Summit, California Presente, Corazón de Resistencia. Coming to you live from beautiful Sacramento, my name is Jocelyn Cuevas from Telemundo 33, where we serve the areas of Sacramento, Stockton, and Modesto. Following our slogan, Trabajando para ti, working for you. Our main goal is to keep our communities safe, protected, and informed. So it's truly an honor for me to be a part of this conversation today and be a part of this event and to serve as MC for today's wonderful event. I am so excited to be here with all of you and with all of the people who will be coming up shortly to speak and to share their knowledge with all of us. And before we get started, I wanted to give a quick announcement to our Spanish speakers who might need some translation. Para aquellos que necesiten traducción, el equipo pondrá instrucciones en la pantalla. Y si usted necesita traducción, presione el icono global y seleccione su idioma preferido. Si necesita más ayuda, use el chat y un miembro del equipo de LCHC les apoyará. So if you need any help, you can see it on the screen. There is a QR code. Puede presionar el código QR y ya allí seleccionar. Y si necesita más ayuda, por favor, escríbanos en el chat y algún miembro del equipo les podrá ayudar. Y bueno, pues today's summit will feature an important data presentation and 3 amazing panels, tackling topics critical to the health of Latin and Indigenous communities all over California and really all over the United States. We will start with a presentation of data linking the Latino GDP and our economic contributions to the need to invest in the health of our community. We will then transition to our panels, beginning with a conversation grounding us in the challenges that immigrant communities have faced this year with policy shifts and actions that have had real consequences on community health and the work that organizations have had to do to meet the moment. After our lunch break this afternoon, we will start back up with a conversation discussing California's Medicaid program, Medi-Cal, and how community organizations and providers are thinking about Medi-Cal policy shifts and new restrictions coming from the federal administration, as well as California in 2026 and beyond. And finally, to wrap up with a conversation focused on the future of the Latino healthcare workforce and an exciting announcement. And of course, you can also find all of this information in our program. On screen, you can find a QR code that will lead you straight to today's program. And you can also access it on the chat so that you can be updated on what we are covering and what will come next. And today we will end our celebration honoring a few champions of our work. So we will definitely be ending on a high note. We're so excited to get this program started and to be here all together, even though it's virtually. I know it will be a wonderful event. And while I'm at it, I want to take this time to thank our amazing sponsors. Your powerful support for the health equity makes this gathering possible. Mil gracias to our Latin health visionary, Delta Dental, and our Latin health champions, California Healthcare Foundation, AARP, Altamade, California Blue Shield Foundation, Kaiser Permanente, St. John's Community Health, California Primary Care Association, HealthNet, Universal Community Health Center, Alcar Health, Latino Community Foundation, Planned Parenthood, Zocalo Health, and our partners at the California Pan-Ethnic Health Network. Thank you all for your kind support and for making today a reality. Let's give them some love in the comments and reactions for our sponsors. If we were live, you would be hearing big roars and applauses for all of you. Thank you so much for your support and for making important events like this possible. And before we get started with our program, we want to acknowledge that we are on Indigenous land here in Sacramento. Thank you to our partners at the Sacramento Native American Healthcare Center for their wonderful resource that is supporting today's land acknowledgement. The history of the Sacramento area and the people is rich in heritage, culture, and tradition. This area was, and still is, the tribal land of the Nicene people. Sacramento was a gathering place for many local tribes who have lived throughout the Central Valley and the foothills for generations, and were the original stewards of this land. We would like to acknowledge the Southern Maidu people to the north, the Valley and Plains Miwok peoples to the south of the American River, and the Patwin Wintun peoples to the west of the Sacramento River. We would also like to honor the Wilton Rancheria, the only federally recognized tribe in Sacramento County. Thank you. Now, I would like to welcome Senior Communications Manager Robert Nunez, who will guide us through an interactive opportunity using the Padlet application, which can be accessed through this QR code that you can see on the screen. Robert, please walk us through this connective tool. I know it's pretty exciting, and we will be really using it today.
Hi, folks. Good afternoon. Good morning. Thank you for joining us. We're really excited to have everyone here. As you know, our policy summit is one of the great ways that LCHC captures community feedback. It's led to some of our most powerful conversations and some of our biggest policy victories. So we are sharing the Padlet QR code on your screen here. You can access our Padlet tool. Through it, we encourage you to share comments to the other panelists, add any questions, any photos of what you're doing this morning, and any uplifting words for the other attendees. You could also input questions, and our staff will be answering those questions and creating an FAQ after the summit. So please be kind and use this tool throughout the summit to connect with other folks. Thank you.
Thank you, Robert. I was downloading it as you were speaking, so hopefully I get the hang of it in a few minutes. If you already are familiar with it, start sending stuff on there so we can feel more connected. Share a photo, emoji, or comment about something that's bringing you energy this morning. For me, what's bringing me lots of energy this morning is being with all of you today. And now I would like to introduce Dr. Seciah Aquino, Executive Director at LCHC. Dr. Aquino holds a doctorate in public health from Harvard University and a Master of Science in Global Medicine from the University of Southern California. She is a Guatemalan immigrant who began her journey in public health as a promotora, and throughout her career has remained committed to creating a culture of health across the nation. In her role now, she is passionate to advance health justice for Cat, Latin, and Indigenous communities through unity, working hand in hand with siblings from fellow systematically disenfranchised and communities of color to advance a unified health equity agenda. Welcome, Doctora Aquino.
Muchísimas gracias, Jocelyn. What a blessing to be here with you all this morning. Thank you for joining us desde sus casitas. It is so exciting to have you all with us today, celebrating. We are here to celebrate our culture, our energy, our joy, because that is who we are as a Latino community. We are that Corazón de Resistencia. And we are here to say we are beautiful, we are powerful, and we're celebrating in our power. So thank you so much for joining us this morning. As Jocelyn mentioned, we are going to have some very exciting conversations today. And before we get started, though, we do want to acknowledge the fact that we are not in person today. I want to be honest and transparent with all of you. It has been a very difficult week. On Tuesday, we received a very concerning call, and It was something that led to a very heavy day on Tuesday, a lot of really hard conversations that needed to happen. And in collaboration with local authorities, including the Sacramento Police Department, the security threat was deemed credible, and we had no other option than to put your lives first, because our lives, our voices are important, and we need to protect everyone, from our community members, all of you, our attendees, our panelists, our staff. Your lives are precious, and we need you in this world. That is part of the resistance, us being able to show up in our jobs, whatever piece of the puzzle that we're holding in this greater public health sphere. We need you there. We need your vocecita, we need your luz to shine strong. And so we practice our values here at LCHC. We are a public health entity after all. And we needed to ensure the safety of all of you and our loved ones. And that is why we decided to pivot. They can't silence us. We will not be silenced. The conversations today are so important that we said, that's okay, we won't be there in person, and made that very difficult decision. But we said, aquí no nos callan. So we are here to speak up and to have those really important conversations virtually. And we've done it before, right? We did it during COVID-19 when we were protecting each other from COVID. And today we are here ensuring that we are all safe and we are moving forward in power. Now, that being said, let me proceed here. We are building on our work from the previous years. As you all might remember, last year we celebrated California Unida. We knew the strength of us being able to come together and fight against what we didn't know what 2025 would bring, right? What that federal administration would bring. But we knew that we needed to bring all of us together and the strength of our vote and our work to be able to impact. Now, right, the elections didn't turn out the way that we had hoped, but that's why we are continuing on this work. Not only are we united, we are presente, California presente, because we are showing up in that strength. We are the heart of California, and we're saying Corazón de Resistencia. Because really, who is leading the resistance across the US? It's California. It's all of us being able to show up and say, that is not okay with us. We are different and we need and deserve better for our communities, for all Californians. And so today, we must acknowledge something that all of us have been feeling. And it's important that we have this conversation. And I just want to take a moment for all of us to just take a deep breath. Just take a deep breath with me here. All of us have been facing a very difficult year. I know I'm feeling it. I don't know if you have felt it, but just an exhaustion of the soul. What is going on? Every day we're facing something difficult. Either the systems that we have fought for are being dismantled, or the communities that we love, our abuelitas, are scared to go outside because of ICE. They're scared to go to, our community members are scared to go to buy groceries. Our day-to-day activities are being impacted. Y quiera que no, poquito a poquito, we have been feeling that pain. And guess what? Because we care about the community, because we care about this work, we get up, we dust ourselves off, and we face the battle day after day. But we must acknowledge that that has an effect on us. So if you're feeling that little tiredness of your soul, of your body, I just want to acknowledge it. I just want to name it so that you know that you are not alone. We are in this fight together. Moral injury is a psychological distress that arises when experiences or events violate our deeply held beliefs. It's characterized by a sense of guilt, shame, existential questioning that result from those actions or omissions against our ethical principles. And we all know that is exactly what we have been facing on a day-to-day basis with this administration. Harold Cohen tells us here in 2021, moral injury was originally discussed in among wartime military personnel. So let's just think about that for a second. It was explored with a population that goes through very difficult occurrences, right? Such as wartime military experiences. But that term was expanded beyond this during the pandemic for healthcare professionals who were facing that very difficult conversation with COVID and a day-to-day exposure to the virus and the exponential effects it had on all of us. But now this term can also include the rest of us, especially those of us working within policy, healthcare, education system, all of our safety net systems that are being attacked and dismantled. What is it? What is moral injury? It's not considered a mental illness, but it is an alteration of cognition and beliefs that can lead to maladaptive coping responses, such as substance misuse, social withdrawal. So if you yourself or you know a friend who has taken a step back from the social interactions, who is feeling a little bit more different than usual, you should know that it's not out of the ordinary. It's a trauma response from the trauma that we are facing. And unfortunately, if we do not take care of ourselves in this moment and our loved ones, it can develop into mental health problems. How do we treat it? The work in the past has flagged a lot of different options for treatment, from reflective practice groups to just having conversations about the awareness, which the goal today is here to name it and to name that awareness, to mindfulness and yoga practices, and even trauma-focused therapy. So please take care of yourself, share with someone about this, because at our workplace, within our family structures, our friends, we need to take care of one another. This is a long fight that we're in. We know that it's not going to end tomorrow. We know what we're facing. We know that many other hard decisions will come our way, but we are not alone in this, and we need you in this fight. So please take care of yourself. And why is that? Folks, we are in a public health emergency, and we must name it as that. The CDC still defines a public health emergency as an event that can cause harm to the health of an individual or to the health of a community. Well, guess what? The health of many communities across the United States has been impacted. Authors in this study, Conceptualizing and Defining Public Health Emergency Preparedness, defined public health emergencies as situations whose scale, timing, or unpredictability threatens to overwhelm routine capabilities. Now, that unpredictability defines the very person that is leading our country at the moment. And it is difficult to know and to phase the threats, and now not just the narrative, right, but very much policy and fiscal impacts of a rhetoric that affects all of us and affects our loved ones and our systems. And why is that? Because time and time again, we have been facing a fear pandemic. We went from a global COVID-19 pandemic to a fear pandemic, folks. And what does this tell us? So the Merriam-Webster dictionary defines an epidemic as something that affects or tends to affect a large number of people, population, communities, right? Now we know that the Latino community has been greatly affected by everything that we've been facing. But because we are a global population, right? We have our communities, our families in Latin American countries. We know that some of our loved ones have had to self-deport. We know that the epidemic doesn't stay here localized. It actually goes global. And therefore, we at LCHC have been coining this term this year as a fear pandemic. We know that we walked into this year with our health being fragile already. Our community is still recovering from the COVID-19 pandemic. The last set of data reported by CDPH in May 2023 indicated about 400,000 Latino deaths and 4 million COVID cases. We are still seeing acute cases. Long COVID and the socioeconomic disparities that were exacerbated during the pandemic are still around. The chilling effect that began during the first Trump presidency was still being felt going into this year, and now even worse. And during the Medi-Cal unwinding, of the 2 million folks that were disenrolled, over 50% were Latino. We also know that poverty is increasing again as those decreased protections that came during the pandemic era relief ended. And we know that this has an effect on our overall health. What have we been facing this year? A traumatic federal administration, like we said, not just when it comes to rhetoric, but also policies. Our community has been under attack and being kidnapped through ICE raids. We have seen policy moves like HR 1 lead to the dismantling of our safety net and healthcare systems. We unfortunately felt a California state budget deficit that we had to be responsive to. And we know we can't forget that we started this year with fire recovery and those climate crises that will continue to be faced in California, unfortunately. Now, what has this led to? A fear pandemic where folks basically had to quarantine again. We know community members, family members, loved ones who had to remain inside their homes and couldn't go out to walk the dog, couldn't go buy their groceries. And we all know what that felt like when we were in quarantine. Well, families had to do it again. Latino families had to do it again this year, but out of fear for their safety. That chilling effect multiplied, right? More than ever, families are scared to interact with government agencies. Our health, including mental and behavioral health disparities, were exacerbated, and we know that it will have an impact on our individual economic well-being. And even through all those difficulties, I will say I am so proud of us because we are a resilient community. As Latinos, we are powerful. We're powerful members of our communities, of the state, and of the economy. And we have the amazing Dr. Hayes-Bautista joining us today to give us a more thorough presentation today on our economic contributions. But look at this number. In 2023, the California Latino GDP was at 1 trillion. That is a beautiful number that actually represents a global economy. We are powerful. And imagine if Latinos can be this powerful facing all those difficulties and disparities. How much more productive economically can we be if our health was prioritized, if our health was respected, and if we were honored in every way? We are a community that brings other people up. We extend a hand. If someone is missing tortillas or doesn't have something to eat that day, we will share what is on our plate with that person who is in need, because that is what defines the Latino community. So we are here as Latinos to make California stronger, better, and we just need to continue to ask California to center our health and our well-being. And that is why today we are here con ese corazón de resistencia. We are saying California is presente. So even beyond all those difficulties that we faced, we did not give up. And what can we celebrate today? We saw SB 81, Care Over Fear, was signed into law. We celebrated on Saturday, September the 20th this year, that Governor Newsom signed SB 81. We are so proud of the amazing work that LCHC led hand in hand with our partners at SEIU, at CIPC, at the California Nurses Association, and in hand with the leadership of Senator Arreguin to ensure that hospitals and clinics remain safe spaces for care, not deportation, and to reaffirm that California is committed to immigrant health equity. And that was just one. There was a package of work that went into this year, and that California in partnership advanced Assembly Bill 49, Senate Bill 627, Senate Bill 805, Senate Bill 98, and of course our Senate Bill 81. What does this tell us? This tells us that we have the answers in our hands. We know what works. During COVID-19, the relief policies that strengthen our safety net, so think about expanding the EITC, expanding child tax credits, housing vouchers, and providing eviction prevention assistance, actually lifted 12 million people out of poverty. So we know that when we strengthen the health and the safety net, we are lifting people out of poverty. We are preventing them to go into poverty. We're strengthening their opportunities for economic well-being and their health. And so we must ensure that as difficult conversations continue to come up this year and in the next 3 years, that we continue to center health and well-being of communities. Our strategy and our vision must remain large. Not only do we have to meet acute solutions, right? Put out those fires, ensure that our communities are well and safe. And also we cannot forget about the long-term solutions, because our communities will come out of this. And in 3 years, we will be seeing where we are as a community, right? But if we don't plant the seeds today to ensure that 3 years from now, we are able to lift our communities even higher, what are we doing? So it is extremely important that we remain in that responsibility in whatever role that you hold and you have the privilege to be in. Please continue to center health and well-being, and let's be creative. We many times talk about these systems not being created by us or for us. Well, here we have an opportunity to create a California-specific system so that regardless of who sits in that presidency, Californians can be protected today and forever. So as we look at this new year, policy, budget, administrative opportunities will come up. Let's continue to center health and safety net, and let's continue to make sure that our narrative is powerful and we continue to center that Corazón de Resistencia. We hope you have a beautiful day today. Be inspired, be encouraged, and we really appreciate you. Thank you. Jocelyn, I'll pass it back to you.
Muchísimas gracias, Doctora Aquino. Thank you for your powerful words. The day is just starting and you've already given us so many wonderful information, and more than anything, really have motivated and inspired us all. So thank you so much for your words. And from one amazing mujer to yet another, we move on to our keynote speaker for this morning, Secretary Kim Johnson. Secretary Johnson was set to join us live this morning. However, she has been pulled away for travel with our governor. And when the governor calls, you have to respond. But she did send over a video with some remarks, and we will be joined live by Dan Torres, Chief Equity Officer at California's Health and Human Services Agency, who will also share some remarks from the agency. But before we hear their remarks, I would like to tell you a bit about Secretary Johnson. Kim Johnson was appointed Secretary of the California Health and Human Services Agency in September 2024 by Governor Newsom. Prior to her appointment as Secretary, Ms. Johnson was appointed Director of the California Department of Social Services by Governor Gavin Newsom, a position she held from July 2019 to August 2024. In this role, Ms. Johnson led a team of over 5,500 employees, the largest department in the California Health and Human Services Agency, serving over 7 million Californians. Ms. Johnson started with the California Department of Social Services in 2015 and had previously been appointed by Governor Jerry Brown to serve as Deputy Director of the Family Engagement and Empowerment Division, CalWorks, and Child Care Branch Chief and Child Care and Refugee Programs Branch Chief. Ms. Johnson has over 25 years of experience working in both community-based organizations and government focused on advancing the health and well-being of individuals, families, and communities most in need of resources. The mission of the California Health and Human Services Agency is aligned with her purpose. And now let's hear the message that she sent over. Let's hear it for Secretary of Health and Human Services, Kim Johnson.
Hello, Latino Coalition for a Healthy California. I'm Kim Johnson, Secretary for the California Health and Human Service Agency. I'm sorry I could not join you in person today, but I appreciate the opportunity first and foremost to say thank you for everything you're doing in service to Californians. We are living in uncertain times, and given this, I want to start by reiterating the California Health and Human Service Agency's guiding principles to guide us in the how we approach our work. We continue to have a focus on equity. It's a continued commitment and shared value and essential to our responsibility to address disparities and disproportionalities in the programs we administer. We actively listen to those being served to guide the program design and policy. We are using data to drive our action, designing with the whole person in mind and breaking down those silos. And we're cultivating a culture of innovation, leveraging our expertise and technology to strengthen program services and supports. And again, thank you for the progress we've made on our strategic priorities together, building a healthy California for all. Our North Star is that all Californians have meaningful and timely access to care, live in healthy communities, and our zip codes no longer predict our health outcomes. We've made tremendous progress in improved access to health care with the lowest uninsured rate in the history of California at 6.4%. We're making drug costs more affordable. We're creating additional investments in reproductive health and much more. We're also transforming behavioral health so that anyone can access services at any place and at any time, and taking away the stigma because we all need help sometimes. And we know we have more to do together. We are also integrating health, housing, and human services, with our North Star being that across our delivery systems, we provide whole person care and address the social drivers of health. And by taking this approach, we're making progress housing our unsheltered neighbors. Some of California's largest communities are reporting substantial decreases in homelessness numbers, indicating that California's comprehensive and strategic approach to reversing this national crisis and getting people out of encampments is working. We are strengthening social well-being, equity, and economic resilience with the North Star that every individual belongs to a strong, thriving, and resilient community where we see our diversity as our strength. According to the California Healthcare Foundation, as of 2022, more than 11 million Californians live in federally designated health professional shortage areas, and 2 out of 3 of these residents are Latino, Black, and/or Indigenous. California Health and Human Services seeks to build economic opportunity and mobility for those that have been marginalized, disadvantaged, and/or denied opportunity and mobility. And we're committed to ensuring better quality and access to care for Californians through a larger, more skilled, culturally competent workforce that is representative of the communities it serves. We're also making a huge cultural shift in how we disrupt poverty through strength-based strategies, concrete supports, and career pathways for families experiencing poverty participating in CalWorks. We are also advancing the well-being of all of California's children and youth so that all children can play, learn, and thrive, and we're confident that we have done all we can to pass them a state that can lead into the future. California will be the first state in the nation to implement a foster care rate system to accelerate a kin-first culture and increase placements with relatives, improving outcomes for foster youth and reducing long-term serious mental illness, homelessness, and incarceration. And finally, we are building an age and disability-friendly state for all, with our North Star being that older and disabled Californians can live with purpose and dignity, and where they are supported and valued. And we've made tremendous progress implementing the Master Plan on Aging. We have a new Master Plan for Developmental Services that was driven by community, and are continuing to implement the approaches recommended to us by community. And we now have a really significant misalignment between our state in California and our values and the federal government. And I want to thank Dan Torres, who I know is with you today, who has led so much of our coordination and preparation and our ability to both respond and be proactive in our thinking about our strategies to address these misalignments. In civil rights and equity, we have seen equity language be struck from various documents and information. We've seen defunding of grants, reinterpretation of discrimination laws, and more. For entitlement programs, we've seen increased work requirements, termination of broad-based categorical eligibility, and funding reductions. We've seen the access to care be compromised for abortions, for reproductive health, for gender-affirming care, and more. And a very, very focused attack on immigrant populations with termination of federal funding, increased enforcement, and new restrictions on eligibility for federal funding. Data. The use of safety net data for immigration enforcement has also been something we've experienced and again believed to be illegal and inconsistent with how we expect our data to be shared and protected in California. So this has required us to have an increased reliance on our own state laws and enforcement, our state funding, and it's put sustained pressure on our programs. And of course, we have the implementation of H.R. 1, what the president references as the big, beautiful bill, that is going to have targeted reductions in access to low-income Californians, whether that be health care, reproductive care, assistance for food, again, focused on immigrant populations, including lawfully present residents and rural communities. We are mitigating many of these through immediate needs or statutory changes that we're making, funding where we can, making sure communications is key to our strategy, looking for opportunities for collaboration across programs, again, technological innovations to reduce the burden on individuals, looking at how we are leveraging our own expertise with both local and state infrastructures. But we have more to do to really ensure that we are making progress on the North Stars that we have set forward. And we can do those things together. You've seen actions most recently taken by the governor and the legislature to ensure continued access to vaccines in California, for example. So we will get through this moment together, and we will continue to keep our North Stars center in front of us. We invite you to collaborate with us to develop and share accurate information for families to help families navigate toward free and low-cost resources at the local and regional levels, to assess ongoing needs in communities, and be sure to share that with us. We are going to leverage our collective experience, knowledge, compassion, and grit to fuel effective implementation and to weather these storms. We honor the resilience of our communities, supporting creativity and innovation to power us towards our progress. And we know that the decisions that we are making today in the short term will also impact the long-term opportunities for those in the future. Thank you again for all that you're doing in support of Californians. Please be sure to care for yourself during these challenging times. We will meet this moment by addressing these challenges together and keeping our North Stars in front of us. Thank you all.
Thank you, everyone, for having us today. My name is Dan Torres. I'm the Chief Equity Officer at California Health and Human Services Agency. I'm also counsel to Secretary Johnson, and what a pleasure it is, an honor it is to be here with you in this moment. As Dr. Aquino laid out, we are facing so many challenges together, and as Secretary Johnson also laid out, we are doing a lot of work right now to try to be as responsive as possible and dealing with the changing landscape that affects us every single day. I just wanted to reiterate a couple of points that Secretary Johnson made about our commitment to equity. We remain steadfast in our work to make sure that we are centering equity for our communities and responding in ways that are helpful. And we also want to underscore her call to action to develop stronger partnerships with all of you. I think what the lesson learned of this year has been how we need to change how we do government in ways that require us to pivot yet again, but in a way that really centers your perspectives in co-designing solutions, hearing from community directly about what's going to be helpful in this moment. And so really need to work more closely with you in ways that are helpful and safe. I really appreciate the pivot that Dr. Aquino describe today, because you know, while we face threats, we need to continue to do the work and find ways to be creative and still remain resilient. And I appreciate the strength of this community and Dr. Aquino to continue the work, even despite what, you know, people throw at us. We stay steadfast and we continue doing what we have to do to protect our communities. So thank you for staying focused. I also just want to reiterate that we, as an agency, you know, want to hear from you. So, to the extent that you have opportunities for us to engage in listening sessions, we've been on the road hearing directly from families who are affected by the changing federal landscape. This week we were in Southern California, listening to families that were affected by the raids over the summer, and hearing what they want to see from California government. And to the extent that you can help us as trusted messengers be better connected to community, we really invite that. We understand that we can't just be you know, operating as government as usual. We have to be much more open and creative to hear from people who are afraid to speak, who are afraid to engage the safety net, who are afraid to go to the doctor, go to the schools, go to work. So we need to think about new approaches for making sure that we are effective in delivering the resources that we have, the access to the safety net that we have in California. So I really want to engage in a partnership with all of you to make sure we can do that. You know, as the Secretary laid out, we are facing tremendous challenges from the federal government in terms of policy changes. We have been in active litigation in partnership with the State Attorney General in multiple states to defend the safety net and to defend data privacy, particular with Medi-Cal data and SNAP data. We have been in litigation and prevailed in getting preliminary injunctions to prevent the federal government from misusing data and sharing Medi-Cal data with ICE. And yesterday we prevailed in litigation and got an injunction against USDA and their attempts to take SNAP data and use it for unlawful purposes. So from our perspective, we continue to hold the line so that we can make sure that the safety net remains accessible to all of our communities and remain focused on protecting civil rights and constitutional rights of everyone in California. So we want to make sure that as things progress and the challenges continue, that we hear from you and we remain steadfast partners with all of you. So again, thank you for the opportunity to be here, and we appreciate the ongoing partnership with all of you, and we hope to stay in touch. Thank you.
Thank you so much, Dan, and please give our thanks to Secretary Johnson. What a powerful way to kick off this summit and to really ground us in all of the work ahead. Thank you so much for your words. And amigos, it's time to get started. And before we move on to the data presentation, I want to remind you all that there is a Q&A option at the bottom of your screen where you can submit any questions as we go on through our day. If anything pops up, you can add them there and then we can address them. So now I want to welcome Dr. David Hayes-Bautista, Distinguished Professor and Director at the UCLA Center for the Study of Latino Health and Culture, David Geffen School of Medicine. And he will be leading us through a data presentation entitled "The Latino GDP Keeps California's Economy Running. Let's Protect the People and Systems Behind It." Dr. Hayes-Bautista is a renowned expert in Latino health who has spent over 40 years working to improve public understanding of Latinos and their health, history, culture, and contributions to California and the nation. I also want to remind you all that our virtual programs have complete bios of all of our speakers if you need any information. Dr. Hayes-Bautista, bienvenido. The floor is all yours.
Thank you very much. I just want to share some information with you all. Not only about Latinos, but also about the future of California and what's going on. So let's just get right to it. We've been working on the Latino GDP for quite some while because it tells us a sense of what do we as Latinos, ¿qué es lo que aportamos? What do we provide? And in two numbers, we get a good idea of what's happening in an area. The two numbers are the size of a GDP And a big GDP is better than a small GDP, and the rate of growth. A growing GDP is best, a flat GDP is disaster, and when it shrinks, all bets are off the table. And the thing about the GDP and the Latino GDP, it doesn't just benefit Latinos. When Latino GDP grows, it benefits everybody in that we have increased standards of living, there's more opportunity for social mobility, and you get rising wages and salary. Everybody, not just Latinos. So earlier this year, we unveiled the 2023 Latino GDP of 4.1 trillion. You may have heard that number a lot. If Latinos were an independent country, reporting separately from the United States, we would have produced the world's 5th largest economy. And during the times of crisis, during COVID, 2019 to 2023, the US Latino GDP had the fastest growth rate, faster than China, and it wound up being bigger than India. That's not too bad. And as we look at the country, in fact, the Latino GDP is growing over 2.5 times more rapidly than the rest of the US GDP. I mean, we're overtaking the US in terms of GDP production. Well, as we look at 2024, we just released some data last week. The trends are in place for this growth to become even better. Now, how do you grow a GDP? A lot of it has to do with human capital, human beings that actually do things. So if you have a labor force that's growing, that's wonderful because then you have more people working. And if they're working harder, they'll be even more productive. So what we should do to make a GDP grow is encourage educational attainment as we move into the global economy, which is a knowledge economy. It's no longer how many widgets can we produce per hour, but how many ideas, and invest in healthy behaviors. And in all of that, Latinos are set to just drive the US GDP into new territory. As we look at the natural population change, now this is really important. Natural growth is the number of births minus the number of deaths. And as you notice here, in the blue column, Latinos have had over 500,000 positive net growth every single year, including COVID, whereas the non-Latino actually has had negative growth. You've had more deaths than births. To make the long story short, for every Latino that dies, 3.7 Latinos are born. For every non-Latino that dies, 9/10 of one is born. That's why we're just getting very solid natural growth, irrespective of immigration. In fact, as we look at the premium, how much more faster is the Latino population growing than the rest of the population? It was at about 1.5% until, again, we got to COVID, things dropped down, but now it has rebounded. Now 2.5% more percentage points premium over non-Latino. And when you have a larger population, you have more people that can enter the labor force. And indeed, the growth of the US labor force year over year of Latinos, and this is the blue column, is over 7 times that of non-Latinos. Basically, Latinos are responsible for the vast majority of growth in the US labor force, which of course produces the GDP. And here we see the premium expressed as percent year over year. And particularly since 2021, there's been a huge increase. And it's not only you have more Latinos and more Latinos working, Latinos work harder. We have consistently had a higher labor force participation rate, 69.0%, as compared to only 62.8% for non-Latinos. I mean, that is almost 7 percentage points higher. And in California, I have traced this premium back to 1940. This is a very Latino thing to do, is to work very hard. And educational attainment has been increasing. That is the number of Latinos with at least a bachelor's degree or more. And it's growing, that population is growing about 3 times the rate of non-Latino population with a bachelor's degree. And we have recovered from COVID. We're back to the famous Latino epidemiological paradox, in which, as we see for the top 5 causes of death, Latinos have a 30% age-adjusted death rate for heart disease compared to non-Hispanic whites, 30% lower death rate for cancer, 25% lower for unintentional injuries, 60% lower for chronic lower respiratory, 10% lower for strokes, overall 30% lower mortality rate. And of course, that leads to, we're almost back to our 3-year longer life expectancy. And this is important for productivity because good health has a positive, sizable, and statistically significant effect on aggregate output. That is, A healthy workforce is more likely to show up as opposed to an unhealthy one who's going to be taking a lot of sick days, which of course cuts productivity. Now let's bring this down to California. The California Latino GDP, as Seciah mentioned, just passed $1 trillion. Now that's pretty good size. That makes the Latino GDP of California alone a member of the G20. But we see some interesting trends as we look at what was going on in California. The California Latino labor force was growing, whereas the non-Latino labor force actually has been shrinking ever since about 2020. It's actually the non-Latino portion is getting smaller, the Latino portion is getting larger. And not only are Latino labor force larger, Latinos work harder. What we saw at the national level, we see at the state level. These blue columns is the Latino labor force participation rate going up consistently ever since about 2017, whereas non-Latino has been dropping consistently. And what's interesting is, where do Latinos contribute the most? The number one sector of the Latino GDP is in finance, insurance, and real estate. I know people say, but aren't you guys out there in agriculture? Well, yes, Latinos are most of the agricultural labor force, but that is a fairly small number of folks compared to the number in finance, insurance, and real estate. And the number two sector is professional and business services. So we're not all in manual labor. In fact, we're increasingly in those areas that really drive the upper end of the knowledge-based economy. So that in California, the Latino GDP grows more than twice as fast as the non-Latino California GDP. Now, putting that all together, let's take a look at what's happening in 2025. Well, in April, Governor Newsom was very pleased to announce that the California GDP overall, which had been for years the world's 5th largest, has now moved up. It's now the 4th largest. We just surpassed Japan in productivity. And everybody was very happy. But we need to point out, here is California now, having just passed Japan, closing in on Germany. But that increase, that overtaking of Japan, was because the Latino GDP was growing twice as fast as the rest. In fact, if you take out the Latino GDP from California, California goes from being number 4 to being number 8 between France and Italy, whereas when it's number 4, it's between Germany and Japan. Now, I'd like to point something out, that the economies we compete with, Germany, Japan, France, and Italy, all offer universal access to healthcare. I know all my life I have been told, we can't possibly offer universal access. It'll bankrupt the economy. And I'm thinking, okay, well, how come it doesn't bankrupt the economy of Germany or Japan or France or Italy? So we are the same size. We have the opportunity. Why can't we offer universal access? Our competitor economies do. And again, it's because the Latino GDP in California is growing twice as fast as the non-Latino GDP. That's great. Now we know everything's set for the Latino GDP to grow in 25, but you can kill the GDP. It is possible. Well, how do you do that? Well, shrink the labor force, so you have fewer people working. Now, in the non-Latino labor force, that's happening because of old age. The baby boomers are aging out, so they're leaving the labor force and they're not being replaced. You can also punish workers, so that you punish the work ethic so that people don't show up for work. You restrict educational attainment so that we're still stuck making widgets while the rest of the world is working with artificial intelligence. And we can reduce access to healthcare so that next time there's a pandemic, there will be fewer workers showing up. And this is exactly what is happening today in California. We are reducing the Latino labor force by going out to the Home Depots, by going out to the construction sites, by capturing Latino businessmen and detaining them and deporting them. Well, in fact, as we look at labor force participation, Latino males, immigrant males, had the highest rate of labor force participation of any group, 78.7%, nearly 8 percentage points higher than US-born Latinos, which is pretty high, both of which are much higher than non-Latino, which is 66%. I mean, How much sense does this make? We all talk about economics, we want economic growth. Well, so then let's go and pick up the group that's really working and throw them out of the country. Hello, does this make economic sense? It's a good way to kill a GDP. And we were told earlier in the year, oh, we're just going to go after the criminals, the worst of the worst. But we can see that we're punishing people who work. They leave their taquero trucks are left running. The leaf blowers are spinning around on the ground. Their carts are toppled over. They are workers. This is not the worst of the worst. Or are you trying to tell me that they're criminals really during the day, but they're just taking time off to go to Home Depot and find a job as a jornalero, go out and pick crops? I don't think so. This is not the worst of the worst. You are picking on the sector that is most active in the labor force that is driving them. And just recently, LA Times noted that 1.2 million immigrants are gone from the labor force. Now remember, not all Latinos are immigrants, not all immigrants are Latinos. So we're going to dig into this. So 1.2 million immigrants are gone, but we're going to figure out, so where do Latinos come in on this? And there's a reason for this. I'll show you shortly why this is an important part. And the state economy is already starting to take a hit because we are removing the most productive workers. We are punishing those who would be working, but now they're afraid to go out for fear of being stopped, detained, and then deported. This is going to affect the GDP. And then, of course, as we look towards the future, there have been all these cuts to education programs. I believe the current administration has the goal of eliminating the Department of Education at the federal level. UCLA, where I am, the only campus founded by a Latino, is being targeted by the Trump administration with a $1 billion fine to unfreeze our federal accounts. We have just become at UCLA a Hispanic serving institution, and suddenly that whole idea is being called unconstitutional. I mean, this is crazy. You want us to compete in the global economy. We need to be investing in education. And of course, we're reducing access to healthcare. And this affects everybody, particularly in the rural counties. We are facing a rural hospital crisis, a rural healthcare provider crisis. And we are cutting back on the Obamacare subsidies. And yet, nearly half, 40% of California births are covered by Medi-Cal. So, what can we do? Well, first of all, what we are trying to do with our Latino GDP is we want to create an economic development dashboard. You notice we've been talking about the GDP for 2023. It's because it takes 2 years to get all the data to compute the GDP that was 2 years ago. But there are a lot of data streams that come in every month that are associated, that are part of that. So we want to set up a dashboard with these monthly and quarterly data so that we can get an idea right now of what is likely to be happening to the Latino GDP, to the labor force, to the population, to its health, educational attainment, all these factors that go into producing a GDP. So we're looking for funds, by the way. If any of you have any leads, we need about $800,000 to do this on an annual basis. We'd like to get this up and running next week, if at all possible. Secondly, if you see something, say something, particularly in the healthcare sector. Having voices, having people, having witnesses really helps. And in the healthcare, we do have certain responsibilities. Now, you all work in different variety of entities. Many of them have already in place protocols. So if ICE comes calling at the door, what should you do? And generally, but please check with your institution, it is uncover your face, show me an identification, show me a warrant with a name on it. That's generally the case. Check, but we do have a responsibility to protect our patients. Thirdly, vote, vote, vote. I know people often say, well, why should I vote? It's just one vote. It doesn't matter. In these polarized times where the House depends on 4 or 5 seats, the Senate depends upon 1 or 2 seats, every vote is critical. And actually, Latinos tend to vote less, in part because we're younger, in part because there are a number of immigrants that need to become naturalized. So vote. And if you can't vote for some reason, find somebody who can vote, get them down to the registrar's office, get them to register and get them to vote. And if they're not eligible because they're not naturalized, but they're eligible to be naturalized, get them to find a friend, get them naturalized, get them registered, get them to vote, because voting makes a change. And we have seen that here in the first 9 months in California. Thanks to the vote, thanks to legislative representation, California looks very different from Texas in that we are trying to protect that growing part of the GDP. We want to protect them because they have lives to live. We want to keep these agents out of our schools, out of our hospitals, out of our clinics, out of sensitive places. At the congressional level, the Hispanic Congressional Caucus has stated its opposition to racial profiling in terms of detecting, detaining, and deporting persons. And California, Oregon, and Washington are now forming a health alliance to provide the types of directives that CDC used to about vaccination, health, etc., but seems to be on the path to no longer doing. So let's go back to our competitors. We're the fourth largest GDP. I think we need to rethink what we do as a state enterprise that is the fourth richest economy in the world. Now, what is interesting is during COVID, almost all economies shrank. The UK shrank by nearly 10%, France by 8%, Germany shrank by 5%, Japan by 4.5%. I just had some visitors from Spain over here at the center. And when COVID hit and their economies, their GDP shrank, none of them thought, well, let's cut health. Well, let's cut education. In fact, when I said, well, that's the first thing we do, we have a budget problem. The first thing is, oh, let's cut health, let's cut education. They said, that's crazy. We don't even think of that. That's the most important thing you can do. You can cut other things, roads, bridges, airports. Why cut health and education? But that is our go-to policy. Cut health, cut education. So they remember the economies that we compete with who offer universal access to care also generally tend to offer pretty good universal access to higher education. How can we continue to compete if we are not investing in our human capital to keep up with them? Now, here is the California Latino population as of 2023. Each column is a 5-year age group. So this column is 0 to 4, 5 to 9, 10 to 14. Now, within each column, the dark blue is the portion that is first generation immigrant. The middle blue is second generation child of immigrants. And then the white blue is third or fourth or fifth or 10th generation. So you notice, by the way, that under the age of 25, about 97% of Latinos are US citizens. They were born here. The immigrants are concentrated actually in the older age groups, 55, 60. You know, it's here, they're the majority of that group. In fact, the median age of an immigrant Latino in California is 49 years, whereas the median age of a US born is 22. This is important because the immigrant portion that created the world's fifth largest economy is starting to hit the age of retirement. They're going to start to leave the labor force, and they're going to be replaced by their children and grandchildren at about a 2-to-1 level. You notice that here is the dark blue, the immigrant. The light blue is about twice the size of that. So what's happening is that the babies that are born this year will enter the labor force by 2041. That's 16 years from now. And they will be employed gainfully until the year 2100. We are seeing the future of the California economy in the delivery rooms this year. And half the babies born are Latino. Nearly half the births are covered by Medi-Cal, and we want to cut Medi-Cal, but we expect them to then be working until the year 2100. We need to give them the best possible start because they will carry this state into the future in competition with the rest of the world. So let's look backwards a little bit. This is something new. We just finished this chart a couple of weeks ago. As we look at Latinos in Los Angeles County from 1781, when LA was founded, you know, check it out. You can go down to La Placita and look at that big bronze plaque. And so this is the growth all the way through the 17th century when we were a Spanish colony, early 18th 1800s when we were part of the Republic of Mexico. Then in 1850, we become part of the United States. Gold is discovered, et cetera. Now, you would think, well, gee, there's nothing happening here. Well, actually there is. It's just when you go from 78 persons to 5 million on the same scale, it's hard to see the 78 persons. So let me just show you. I'll bump up this portion here. The first 100 years of Los Angeles County. Now you can see more clearly that during the Viceroyalty, Latinos were growing. During the Mexican Republic, they were growing. And as part of the US, we were growing. Let's come back. Now, the non-Hispanic white population of Los Angeles really began to grow about 1920, and then it grew and grew and grew and grew until 1960. It hit a peak of just under 5 million, and since then has actually shrunk. So now the non-Hispanic white population of LA County is about 2.5 million. Latinos, remember, we start in 1781, and we hit our growth spurt around about 1930, and we grow and we grow. And you notice at about the same rate, the same slope as non-Hispanic whites, with about a 30-year differential. So now Latinos come in at almost 5 million. What's going to happen in the future? Well, I don't think we're going to get the same tail off. There are different demographics at work. But what's interesting is this growth spurt occurred during 100 years of deportations. Now, I personally have lived through 5 waves of deportations since I was a kid. And my parents lived through an additional wave in the 1930s that took place here. Starting in 1929, there was a huge wave, massive wave of deportations. Why? Well, because Mexicans were stealing jobs from everybody else. Does this sound familiar? And in fact, almost 2 million people were deported. And at today's scale, that would mean 5 million Latinos being deported out of California in the next couple of years, and about another 3.5 million out of Texas. So that was a huge scale. Many of them, some analysts think as much as 60%, by the way, of those deported are actually US citizens, such as Romana Bañuelos, who was deported twice during the deportation, and she was US citizen. She later became the first Latina US treasurer. She actually signed every dollar bill during the Nixon administration. Then, and this is the one I remember, the wetback raiders, as they were called, Operation Wetback, and they would interrogate Mexican-looking citizens. Does this sound familiar? This is nothing new. We had the US Army involved, the military was involved in tracking down so-called wetbacks and deporting. Then in the 60s, early 70s, you had under Nixon Operation Intercept. And so they're going to close and seal the border so that people wouldn't sneak over the border. You know how all that worked. Of course, in the 1990s, there was the famous Proposition 187. And I need to remind people, both Republicans and Democrats supported 187. The very liberal Senator Feinstein, supported it. We met with her. We tried to jam her at her office over here. And she actually did the one ad that most people remember that lived through that, the worst ad, and they keep coming, 3,000 a night across the border. That was Dianne Feinstein's. So we were like totally alone when this happened. We had no one we could look to. We had to respond by ourselves. The deporter in chief, as you look at the numbers, President Obama was not very immigrant friendly to begin with. Undocumented were excluded permanently from buying Obamacare, even if they wanted to buy insurance with their own money. And recent immigrants up to 5 years were also ineligible. And then he deported a few million people. We used to call him the deporter in chief, and he hated that, but he was. And he developed the baby cages and family separations. Then, of course, we could call them the Home Depot raids, the ICE raids that are occurring. But this is the 5th wave I have experienced, and with my parents. And if epigenetics, I probably had that 6th wave was engraved on my DNA in some fashion. So I have lived through almost a century of deportations, but it did not stop the Latino GDP. And it didn't stop Latino growth from being a small, less than 250,000 back in 1940 to 15 million in California, 68 million in the United States, even though they have tried for 100 years. Throw it at us, throw it at us, throw it at us. You know what? We're resilient. We're tough. I know it seems horrible now. It has been worse in the past. We now have some legal representation. We have some political representation. We need more. But we need to be thinking of ourselves as powerful. We have driven California to be number 4 in the world. All our competitor economies offer universal access to care, virtually free college and postgraduate education. We want to keep up with them. We can do it. 1 out of every 2 Californians is a Latino. 1 out of every 5 Americans is a Latino. We will continue to thrive and grow. Throw at us what you will. Didn't stop us. 100 years of deportations did not stop us. That is why we have such good GDP figures. And people ask, well, what do you ask of these programs? I say, well, at the very least, get out of our way. Don't get in our way. Get out of our way. And if you want even more GDP growth, invest in our education, invest in our health, and we will keep California competitive for the rest of the 21st century. Thank you very much.
Thank you, Dr. Hayes-Bautista, for such an insightful presentation. And yes, we are powerful. It's clear that in California, Latinos help give that significant boost to our state GDP, and that we need to be valuing our community for those contributions by investing in the systems that keep Latinos healthy and safe. And team, I can see a lot of you adding in the chat. Please, I want to remind you that you can also add anything into the Q&A option on the bottom of your screen, as well as you can also use the Padlet. Next up, I am honored to welcome our first panel entitled Holding Our Community, Fighting Back for Our Health in a Year of Anti-Immigrant Policies. This panel is being moderated by LCHC's Deputy Director, Rita Medina. Let's welcome our moderator and panelists. Rita, you may begin when you are ready.
Thank you, Jocelyn. Good morning. I hope everyone can hear me. I am not the best with technology, and so I'm going to do my very best as we have our first Zoom panel of the day. And I have the honor of moderating this panel. As was said, my name is Rita Medina. I am the Deputy Director here at LCHC. And I'm just so excited to be amongst some greats, some giants. I have had the privilege of seeing each of these people in action, knowing some of you folks in your work for a while and working in partnership. And so grateful to be here in virtual partnership. And really that I hope this is a conversation that will also ground us in the new realities and challenges that we're facing as community members, as CBOs, as safety net providers, and beyond. It's hard to talk about paths forward when we know that our communities are facing attacks to their mental health, their physical well-being. But we have to hold both things. We have to talk about those impacts, and we have to talk about the way forward, because that is our reality. So I'm going to quickly introduce my wonderful panelists here today, and then I will ask them to introduce themselves and their organizations in more detail as we start in on the conversation. So in no particular order, with us today, we have Luz Gallegos, who's Executive Director of TODEC. We have Jim Manja, who is President and CEO of St. John's Community Health. We have Rudy Espinosa, who's CEO of Inclusive Action for the City. And we have Janet Martinez, who is Executive Director, of Cielo, Comunidades Indígenas en Liderazgo. So drop some love in the chat for our panelists. I love them. I'm sure you do too. And let's get into it. So I'm going to start us off, and I will just preface, this is going to be a heavy conversation, and I want us to acknowledge that heaviness, and then we're going to be moving forward into a little bit of now what are we doing with everything that's before us. So since January, our communities and organizations have been living through a constant barrage of bad news, bad policies, and community threats. And bad is probably not even the best word for it. They've been horrific. So we started the year with an attack on birthright citizenship, news of IRS and Medicaid data sharing with the Department of Homeland Security, ending of temporary protected statuses for certain countries, attacks on DEI and nonprofit organization, and on top of all of that, state cuts to Medi-Cal, on top of everything else that was coming from the federal government. That's a pretty long list, and I wanted to list that out because it's really important for us to have that list in mind, because this is everything that happened even before the large-scale raids that we saw taking place largely in Southern California and the raids that began in Los Angeles in June. And all of these actions have had an impact on our health, be it physical or mental health. Our communities have been impacted tremendously, but the community response has also been just tremendous. And that's just who we are as, as a community. We show up for one another. So in today's discussion, we will reflect on the lessons learned, the community responses and solutions, or new strategies that have been instrumental in helping all of us move forward. And the people who are going to usher us through that conversation are with me today. So I'm going to go ahead and get started. And Janet and Rudy, I'm going to start with you both and in that order. So I'll turn to you. But I want to ground us. It's June 2025, and the raids are happening in Los Angeles. You know, LCHC, we were in a meeting down the street at the California Endowment when all of this was taking place. And Cielo, actually, some of your folks were there in the room with us. But as organizations in the heart of Los Angeles, and Janet, I'm going to start with you, walk us through the first 72 hours of what the response from Cielo looked like.
Hello, everyone. Thank you, Rita, for moderating this conversation. Thank you to the staff of LCHC for pivoting so quickly. I appreciate all your work and for the invite to sit here with you all. My name is Janet Martinez. I'm the Vice Executive Director at Comunidades Indígenas en Liderazgo Cielo. We're an Indigenous-led, women-led organization out of Los Angeles. And for us, I think that exactly, some of our team members were over there with the other compañeras. And I think everybody was shocked initially. I think that was like at least the reaction for the organization. All of us were like, well, what do we do? Like, do we go to the protest? Like, do we go, you know, I think it was a scramble, but what we ended up doing in the beginning was going to the protest, right? And of course, one of the things that we saw during that time in the beginning of June was that we started to adapt our food pantry program. And from our food pantry program, instead of having people pick up their food, we started to have it be dropped off, right? To community members that were too afraid to leave their homes, to community members that were, you know, terrified. Because I think one of the things that was really impactful in Los Angeles is that the degree that the raids were made a show, right, to create terror and fear in community, but also, like, you know, eventually the sending of the National Guard to the city. And I think that was something that was very impactful for a lot of people and really scary. So in total, we continue to provide what was around to date 2,349 food boxes. That's on average around a family of 4 that we serve, and that's around 9,393 individuals that were fed through those food boxes. And a percentage of those food boxes were actually delivered to the homes of community members, because we knew that a lot of people were struggling with accessing food, just food in general, just because also the raids impacted a lot of the businesses. We saw that businesses were closing or shortening their hours due to the fear of the raids going into businesses in the beginning of the raids. So I think that it's kind of like a compound effect, right? Like first, COVID, then the fires hit Los Angeles, then the raids hit Los Angeles. So I think it's been a compounding effect on a lot of community members. So being able to try to react and be a constant as an organization was really important to us, to not deviate like from the essential services that we did provide. And eventually we also had to adapt in the way of delivering food or adapting the way that we provide our food pantry program. But also we had to adapt in trying to figure out what happens to the families that were left impacted, that had like one of their family members kidnapped from the streets of Los Angeles. So I think that was also like something that's, I think, emotionally tolling. And I guess we've lived a lot of firsts in our lifetimes to see the raids like this, the pandemic, the fires. So I think that we're living in unprecedented times.
I want to acknowledge the heaviness, and I said this at the top, but thank you for, you know, talking about specifically the families that you are working with who've been impacted, who've had loved ones disappeared, or who have themselves been impacted by enforcement, including children thinking about the schools. And you mentioned businesses. And so, Rudy, I want to turn to you. I said I was coming to you next as another organization in the heart of LA, and one that works really closely with vendors. I know when we had a conversation before this, you and I talked about this moment that Inclusive Action was facing about your CBO lender, but balancing that with immigrant rights. And I wonder if you can share what that was like the first 72 hours.
Yeah, team. Hi, everybody. Inclusive Action is an economic justice organization. We're a certified community development financial institution. Which means that we are a small business lender. We provide low interest loans to small businesses that can't get capital from big banks. We also provide business coaching. And historically, we've also been an advocate in various spaces. And we worked certainly with Rita and Janet and others on this call to advance policies to support our community. And we work with a lot of different types of people, a lot of different types of organizations, both in the nonprofit sector and the private sector. And when the raids began, one of the realizations that we had is that, we have a lot of identities at Inclusive Action. We operate in different ecosystems, but one of those ecosystems that we must occupy is the arena of an immigrant rights organization. The majority of our clients are immigrants. The majority of the businesses that we serve are immigrant led businesses. And we are in a space where even probably some people here that are listening are wondering, what is their role? And do they have a role to play in defending our communities? I certainly am engaging with a lot of different institutions that are staying silent because they feel that this is not their fight. And at Inclusive Action, we came to the recognition really fast that we are also an immigrant rights organization. We are a lender, we're a policy advocate, but we are also an immigrant rights organization, and we have to do everything that we can to support and defend our communities during this time. And I'd like to invite everybody to think about what is your identity and the role that you're playing during this moment, because everybody has a role to play, I think. And so, when we made that, when we affirmed that, Rita, at the office with the team, I think the team was really aligned with that, because many of us have personal lived experiences of growing up in immigrant families and mixed status families. This is about us. They don't want us to exist. And so we have to do everything that we can to make sure that we are advancing what we believe is an inclusive vision for our economy and our country.
Beautifully said. And I'm sure other organizations, and I know we'll get into the lender world and how you all are turning things on the head and supporting the workers. And I want to thank you, Janet, for also bringing up the fires, because that is something that I left off the list because it wasn't a federal policy, but it was definitely a disaster that compounded so much of everything. And I want to acknowledge the work that both Cielo and Inclusive Action also did to respond to workers during the fires and to support their income or lack of income during that time. So LA, it's the raids, it's a heavy time, but I want to travel us east down the freeway. I'm a Riverside native, so I picture myself driving home, and I want to take us to the Inland Empire in the Coachella Valley. And I want to turn to you, Luz, because I think when we think about the impact of the raids, those first 72 hours, a lot of our minds go to what we saw on TV and just in LA. But I want you to help us paint a picture of a community just outside of Los Angeles and what those 72 hours were like for you, inklings of things to come, just, how the community received this news and how Todec was sprung into action.
Thank you, Rita. Luz Gallegos with Todec out of the Coachella Valley in the Inland Empire, immigrant and farm worker justice organization. Just hearing all our compañeros and seeing the realities of LA, but in all honesty, in the inland, we're used to seeing immigration in our streets all the time. We are a part of a border region. Many of our communities and cities are. So our community is used to seeing Border Patrol. But what we haven't been used to is all the rhetoric and the increased enforcement and criminalization of our community. But to your question, as far as the the 72 hours, what we could say is that we have been responding and organizing since early the summer of 2024, as we did not know what to expect in the outcome of the elections. But we knew as a region that we needed to be ready for anything, because we have learned through our work that history repeats itself. So we started very heavily doing community education and organizing, and our community members and also our volunteers to be ready to respond. And through the work in January, when January came, we activated our membership hotline, which is a hotline that we have for over 30 years that responds to crises as it deals with immigration. So since then, you know, it's been active. And in hours before LA got hit, the hotels and many community members started calling our hotline, letting us know that there was increased vehicles in our area in Coachella Valley. So right away, our call center team sends out our trained volunteers to start documenting all of the situation. And in fact, we started seeing many of our hotels were occupying these federal agencies. We did not know where they were going to hit. We were all honesty, we thought they were going to hit our region. So right away, we activated our protocols in the Valley, from school districts to all the partners to our volunteers and community to be ready, because we had to be ready in case they went in full force in the Coachella Valley. We had staff that actually stayed over in the hotels to monitor the situation and to follow them. They were up early, left the region. Our team followed them all the way out of the IE, but we did not have any idea where they were going. After they left the IE, our team turned around and communicated to our partners the situation. But then later on, we find out that they hit our partners, our neighbors in LA, and that totally broke our heart. And that from there, we reinforced our protocols. We are working very intentionally and strategically across the state with so many partners. We have to support each other, right? Because we are seeing how they're staging and how they're impacting our community, and how collectively we are all responding. But it has to be a coordinated effort that we're all trying to do our best to keep up with the demand. But in all honesty, this was a big eye opener for the IE. Few days later, we got hit in the Coachella Valley on June 18th, you know, and we had over 500 agents coming over to our region. We started getting calls at 6 in the morning. Right away, our teams deployed our volunteers, and they documented all 3 staging areas in the Coachella Valley. As a community, once we documented the staging, over 500 agents, military drones, helicopters in our community, we let all our community know, from top down, bottom up. We wanted to keep community safe, and we saw that all of this prevention work that we've been doing with bottom up, top down, every single person that serves immigrants, from media to school districts, kept our community safe. As we were telling them, if you haven't left, don't leave, stay home. Our growers, you know, were ready to respond and enforcing their constitutional rights. If you don't have a warrant, you can't come into my spaces. So later on, we found out it was a targeted situation, that, you know, they were targeting some of our fields, right? But we didn't have the collateral that other places had, and we're very blessed for this of the work that has been going on in organizing for so many years, that we saw it played out. But this was a snapshot of what we could foresee happening in our communities, especially here in the state of California.
And I want to go back in a minute to, as I want you to hang on to that constitutional rights piece, because I want to get into eventually talking about the Know Your Rights work and how that's kind of been turned on its head. But so 72 hours, we're back there. It's June. We have a summer of new realities for what it means for our families. People scared to leave their homes, scared to go to work, students, you know, home from school, schools trying to do their best to protect. But Jim, I want to bring you into this conversation now, because now, you know, we're a few weeks out. Again, it's a new summer, new reality. And I want to bring St. John specifically into this conversation to move us into the weeks directly following the raids. And St. John's clinics are largely based in LA, but you have some presence in the Inland Empire as well. And I think, correct me if I'm wrong, serving 120,000 folks across 28 sites. And so I wanted to turn to you. How did the raids and the summer of enforcement affect your facilities and your staff? And how did you all have to pivot to sort of meet the moment when basic needs were on the line?
So St. John's has serves the largest number of immigrant families and patients of any federally qualified health center in the country. So we were preparing for what we thought was going to happen once Trump was elected, and we began calling all of our 30,000 undocumented patients that we know of. We think our numbers are actually higher than that, and we don't collect that information, but because of various when they enrolled and what they enrolled in at different times that they've been patients of St. John's, we're able to identify about 30,000 of our patients. And so we began calling them and talking to them about whether they would be willing to have a doctor visit their home, because we were training up teams of providers, medical assistants, pharmacists, and doctors to go to people's homes should the raids occur. And most of the patients said yes, they trusted St. John's, and they would welcome a doctor coming to their home if they, for some reason, were afraid to come into the clinic. So when the raids hit, we saw our no-show rates go from an average of 8 or 9% a day to up to 35% a day. And so we immediately mobilized our healthcare without fear teams, is what we called it, healthcare without fear. And we began seeing patients in their homes and seeing hundreds of patients a week, and delivering their medicine, taking their blood, doing follow-up telehealth. And then what our doctors came back saying was that many of the patients that we were seeing were afraid to go to the grocery store, and they didn't have food. So one of our patients who'd been doing really well had diabetes. When we took her hemoglobin A1C, when they visited her home, her blood sugar was through the roof, and they were just about to take her off her diabetes medication because she had been doing so well. And the doctor asked her, what happened? You were doing so well. She said, well, I was afraid to go to the grocery store. I lost my job. I didn't have a lot of money. And so the only thing I had in the house were tortillas and coffee. And that's what I've been eating for the last 6 days. And so we realized that our doctors had to come to the homes with food. And so we started bringing groceries with every visit. But we really got to see the impact of the kidnappings, the brutality, the fear that produced. And patients were literally afraid to pick up their medicine or come in to see the doctor. And so we were able to pivot, but it was the state refused to reimburse us for those home visits. So all of that was done, based on our general fund. But we were able to provide that care that people needed, thank God.
And I want to appreciate this moment, and I want to open it up actually to our panelists, to Luz, to Janet. We're talking about the clients that access clinic care for mental health, physical health. Is what Jim's sharing, how is that resonating with what you were seeing in the weeks and months following the raids with your folks in community? Maybe Luz, I'll start with you and then go to Janet.
Yes, what we saw and we continue seeing is, especially with all the data sharing of community members, right, is that communities just trying to stay off the grid. We've had so many stories that I can share, but one of them that comes to mind is an elder that she needed to get her dialysis done, and she was saying, I can't go, I can't go because of the fear. She didn't want to go get assistance at her normal clinic. She didn't want to use her Medi-Cal. She did not want to go into any type of facility that had her information. Her daughter reached out to us and asked us, that her mom needed, urgent assistance because she relied on this medical care. So what we did is we connected with one of our medical clinics locally here and explained the situation and asked them if we're able to pay as ourselves and not how can we support this community member. So at the end of the day, we were able to get the support that she needed in a way that she felt comfortable, but then in a way that kept her alive. And these situations continue to happen in different realities for every family. But right now, more than ever, what really, really breaks our hearts is that we have organized for so many years to make the expansion of Medi-Cal happen for our most vulnerable workforce in the state of California. And right now they're scared of accessing it. We're seeing the high need of mental health services in high demand as we continue seeing communities trauma because of the fear that they have to even leave their house. We continue seeing how these realities continue to be more and more heavy. And when community tells us, I want to self-deport, at this point, we're respecting our community wishes because only they know what they're going through with all their trauma. And we rather see them alive and well in a state that they could be free and that they're not caged up at home and thinking of all these different traumas that our community is going through, fearing even going to church and how that's impacting their well-being as a whole and as a within their families.
Thank you, Luz, and thank you for sharing those experiences for folks who are not here to share those stories themselves. We appreciate that. Janet, I want to turn to you, and also when I asked this question about the health impacts and kind of responding to Jim, I'm also thinking about it through the lens of we're having this conversation, and often the immigrant rights space is in a bilingual framework. We Spanish and English. Our API community is also present, and there are many languages there, but also in the Indigenous and Mesoamerican community, there's a breadth of languages. And so how, as you're trying to get this information out, know your rights, healthcare access, trying to clear up, misinformation, disinformation, how does that also look and present itself when you're talking about Indigenous languages?
Yeah, I think initially before all the raids happened, before all of this, and we were like, know your rights is going to work. We started doing a lot of know your rights material in Indigenous languages. On our site, we have around 16 that are open to use for anybody who wants to use them. Y'all are free to access them through our website. We have Mixteco, we have Zapoteco, we have Acateco, Canjobal, Quiche, some of the most encountered languages that we work with, right? And we did have this up. We did know your rights workshops previous to all of this. But I think that it was unprecedented the way that we didn't know that our constitutional rights weren't going to be respected, because I think that that's where we're at now, right? But I think it doesn't mean that we're going to stop making these materials, but you can access the resources on our website. There's a tab called resources, and I can put it in the chat for you all for whoever wants to use it. It's open access. Y'all can download it, share it with community members. But I think that more to the response of like the health question that Jim kind of presented, I do want to reflect on like the food insecurity that families are currently experiencing. I think that it has like a collateral effect to their health, like whether it's diabetes, but I also think that it has a huge impact on mental health. And I think that that's something that we've seen in our community meetings. We had to make a decision, right? Do we want to be in person? Do we want to transition to be online? And when we checked in with them, they were like, no, like we need to get out of our houses. We can't continue to be caged up like this. Like this isn't life to not be able to go out. So we started having our monthly cafecitos con cielo that our community outreach community does, right, once a month, and we meet once a month with the community members, and they've done a spectacular job of creating that space where we've been able to hear directly from community members who have been impacted. Like, I think that the level of anxiety that people are living right now is unsustainable for us, and we do have to create outlets for it. One story that really impacted me was to see a community member come to the Cafecito con Cielo and share with us, before I used to ride the bus to work, and it was great when I would come back because I would fall asleep because there was air conditioning. He's like, now, ni de chiste me duermo en el autobús, which is, I wouldn't even dream of like falling asleep on the bus, right? Because I don't know who would grab me. And I think that that's like a sentiment that a lot of people have, that things that were everyday activities, like going to pick up your kids from school or going to work, you just don't know if you're going to come home anymore. And I think to Rudy's point about, is this something that we have to define as organizations or as people? What's our role? And I think for Cielo, it's really been, we live in racialized bodies as Indigenous people, right? We are very, very identifiable. We are very othered, even within the Latino community, right? As Indigenous, as brown, as shorter, as darker than most. And I think that like really the raids have been targeting people that are others, right? That do not look like they are Americans, that do not look like they belong here in this imaginary of the MAGAs. So I think that that's definitely something that is part of our lived experience, but also so important for our work, because it teaches us that we're not necessarily going to be accepted into mainstream American dreams, American ideals. So it is our fight, even if we're documented or undocumented, it's our fight. Like, we have to take it on. And I just really want to acknowledge the volunteers at Cielo. We had young people during the summer, and I think it was something that gave me a lot of hope to see the young people volunteer, because even if they were born in the US, they weren't like, that's not our community anymore, this isn't our fight. They came to volunteer, they came to pack the food boxes, they came to help, deliver the food boxes to families. And I think that to me really made me think, like, even these teenagers understand that they have a part in creating collective safety for Indigenous communities in Los Angeles. And, they were like young Zapotec teenagers that were coming to give their time during the summer. And I think that gives me hope, at least, that there's young people that know that documents, even with documents, that this is their fight, right? That it isn't like, oh, I'm documented or these are undocumented. No, they were there, they were active. And I think that that's something that is maybe like a point of like the wider discussion, right? Like, living in racialized bodies is definitely something that I think has made it deeply personal, whether despite your status, and being part of this movement and fighting for migrant rights, I think is definitely something that Cielo has also said, like, this isn't even a conversation, right? I think we knew instinctively like where we wanted to go and what we wanted to do.
Thank you, Janet. That was one of our calls to action. I don't know how to do emojis when I'm moderating. So all the emojis, because it's true, right? We're all called to action in this moment. And so I want to take some more action. I'm going to turn it back to you, Rudy. Inclusive action, thinking of the business world, but also some of the programs that you all undertake with some of the workers. And so, speaking of taking action, right? Showing up in the roles in which we play. How did inclusive action feel? How were you able to show up in this moment through your programming and decisions that you were making?
Thank you, Rita. Friends, we believe that economics is integral to health. If someone doesn't have resources, it's going to be very difficult for them to be healthy. And we see that every single day with the small businesses and workers that we engage with. And if you go into our portfolio of borrowers that take advantage of our low interest loan program, maybe 25% are street vendors, maybe a little bit more. And these street vendors were calling us immediately when the raids began of like, I'm afraid to work. How am I going to be able to pay not only my loan with you, but how am I going to pay for the other things? And so I'm really proud of my team, a team that has their own lived experiences, as I mentioned, that is very, very values aligned, that was like quick with like, we need to make sure we're supporting our borrowers, as street vendors especially, by helping them get no cost deferment just to see how this is going to play out. And so that was like one immediate thing that we did. The second thing that we did is we started to call our donors and our investors. and said, hey, you know what? Not only do we want to do a no cost deferral, we need to figure out how to relieve some of this debt. We need to forgive some loans right now because we don't know when this is going to be over. And so that was an immediate thing that we began doing. And so we've been lucky in getting some resources to make some helpful calls to street vendors to say, hey, guess what? You don't have to worry about this anymore. And so those are a couple of the many things that we did. That led into other ways that we can be even more proactive. We joined forces with the LA Street Vendor Campaign, Community Power Collective, Public Council, East LA Community Corporation to organize the LA Street Vendor Solidarity Fund. And as of this morning, we've supported over 800 street vendors with cash assistance, small $500 cash cards that we also raised by organizing donors and saying, hey, you need to contribute to this. I will tell you that it's been very hard. I'm sure folks that are doing this work know that it's been hard to raise money for this particular issue. We did a similar fund for the fire victims, for workers that were impacted by the fire. And I'll tell y'all, it was way easier to raise money for that it's not as easy to raise money for this. I think there's a lot of companies that still don't know that they have a role to play in this. And so we are doing our best to educate them about how they can participate in supporting folks. But, Rita, before I close, the organization is doing a lot of things. And as we provide cash to people to support them, we realize that that's not enough. We have to focus on the systems that are causing this. And so I'm really happy to report that last week, Governor Newsom signed a bill that we co-sponsored, the Street Vendor Business Protection Act, that is protecting the data of street vendors in California from it being shared with ICE, Senate Bill 635. Shout out to Senator Maria Elena Durazo on that. But I want you all to know that, it's only going to get worse. I want you to know that 4 weeks ago, ICE requested the data of 1.28 million taxpayers to find out where they live. And you all know, probably on this call, that undocumented immigrants pay almost $100 billion in taxes every single year. And this administration wants to weaponize that data to find where they live so they could come to their houses. This is an existential threat, not only to immigrants, but to the foundation of our economy. And so inclusive action is a plaintiff in a lawsuit to stop this. But y'all, it's not looking good. We have to really step up to the plate on this. And I want to share, Rita, just to be a little more, I want to be a little dynamic on this panel, that I got a text right now while I was on this call. Someone said, hey, did you see this? And I want folks to just click that link and read the letter from Senator Cotton about what he's saying about immigrants in the banking system. And I want us to read it and soak it in and realize that that our communities, but the whole democracy is under threat. They don't want us here. And so we have to do everything that we can using all our skill sets and our voices to not only fight back, but to build a future that we all deserve here. And my future is one in which immigrants are building businesses, paying their taxes, owning property, creating jobs. We're taking care of each other. That's the vision that I want. And so I'll stop there, Rita. But inclusive action is flexing on both the finance side and on the advocacy side as much as we can.
I appreciate you dropping the link. I think folks have been sharing their links. I heard ask number 2. Show up, be an ally. It's ask number 1. Ask number 2 is fund a friend. Drop your links if you're raising money. I know that there are lots of funders who are probably watching. Then we'll get to that too. What do we need to be sustainable? Part of it is raising money for these funds. And Jim, I see you unmuted. I was going to go to you, but did you have a comment to make there before I turn to my question for you?
I'm sorry.
Okay, I saw your box light up. But I did want to turn to you because we have been talking about a lot of what has been the impact of federal enforcement and things that are outside of California that have been impacts and attacks on our health. But, we talked about holding two realities. We're also fighting a war on two fronts in a sense, a policy war in Sacramento. As all of this is unfolding, as we have all of these enforcement challenges and we have this increase of raids, we also have this policy fight and this battle in Sacramento with our state budget. The state budget is bleeding. We're severely in debt, and we are, as advocates, this past summer we were trying to fight to protect access to health for all. And as we know, that fight ended with significant cuts and freezes to this program that has taken over a decade to cement. Luz, to your point, right? We work so hard, all of us here, to fight for access to that program. Most recently, seniors and folks of all ages were able to access and finally get that health care, only to have this budget season claw that back. And so, Jim, I want to take us to you, because I know that St. John's, I've seen you in the halls. You all have been really active in this fight. And I want to just have you share a little bit about, as we're dealing with these enforcement pieces, how you all have been doing on the advocacy side to fight and protect for health for all, and what needs to continue to happen this year.
So, one of the things that I think we have to learn is that we have to fight on the political front, but we also have to fight on the policy front. So, the governor has developed this initiative, Prop 50, to add Democratic seats in Congress in response to Trump's power attempts to seal the election. And that's a very bold and important political move to make. But at the same time that he's doing that, he's proposing deep cuts which were voted on and supported by the legislature, that would essentially eliminate healthcare and Medi-Cal expansion for the undocumented. The fact that California expanded Medi-Cal with state funds to provide Medi-Cal benefits to millions of immigrant Californians was probably one of the most significant wins and significant policy impacts that we've seen in our generation. And to claw that back now is not only in the face of these raids, in the face of these attacks that all of us are talking about together today, I think is really cynical and disturbing. And so we are planning to bring together a coalition to put either a county or a state ballot measure on the ballot for the citizens to vote for, which would raise taxes on the rich, particularly on billionaires, would bring in billions and billions of dollars for Medi-Cal to restore the benefits to immigrant families that the governor ripped away. And I think what's important about this is that not only did he make, install fees that people have to pay. So when you're on Medi-Cal, you're at the poverty level, and to ask families of four to pay $30 each per month to keep their Medi-Cal, and then to cut the rates that nonprofit community clinics receive for providing Medi-Cal services to immigrant families by 80%. So the governor cut 80% of the funding that goes to all of us who provide services to the undocumented, in order to further discourage and create more barriers to health for this population. So we believe that healthcare providers, immigrant advocates, all of us have to come together, labor unions, and put an initiative on the ballot to say that we are not going to cut back on Medi-Cal for our immigrant families, and that we are going to restore those healthcare cuts, both from the governor and also from President Trump, to make sure that immigrants continue to receive healthcare services in the state of California.
I appreciate that, because healthcare is a human right. That's, one of our grounding principles. And I think what we're talking about here is not just access to health, but all of the social determinants of health. And I want to thank you for kind of painting that picture of what's happening in Sacramento, but also locally, to try to solve for what's happening in Sacramento that is also being impacted because of the federal administration, right? This is all domino effects with HR1 and federal policies. But of course, in our own backyard, we have decisions to make about how we spend our money and our budget. But you talked a little bit about advocacy and showing up. And so, Luz, I want to turn to you. We had this conversation the other day. I'm thinking about Sacramento. I'm thinking about our advocacy days as we know them, walking the halls. And I'm also reflecting on this past year and how hard it's been, thinking about people being afraid to leave their homes, their communities. And so how are we thinking about showing up differently in our communities? Is it young people? Who is showing up now, and who is still organizing and putting this with these fights like Health for All? You all are part of the Health for All Coalition. So I want to hear a little bit more about how you're thinking about the advocacy for Health for All.
So the way we are not just thinking, but the way we're taking action, it just didn't just start because of all this crisis we're all living in, but it really started when we're pushing for the expansion for Health for All elders. When our grandparents, our abuelas, our abuelos were on the line, that we saw that a lot of them couldn't even walk. I know within one of our actions in Sacramento that we had all together, we mobilized our abuelos on wheelchairs. Imagine a 8-hour drive from the Coachella, the IE, all the way to Sacramento. We saw how that impacted their health and well-being. So at that point, our Monarcas Luchadoras, which is our youth leadership program, which is a pipeline that many of us come from, have been taking action, right? Mobilizing hundreds of our young leaders to step up and to be the voice of their grandparents, now, their parents, their community, and we continue seeing with our young. That's why, we are very hopeful because we see the pipeline of conscience youth leaders that we have been organizing and leading and training them to be the voice, right? Many of them come from different backgrounds. They're either refugees, immigrants themselves, DACA recipients, or US born, but they all have something, a common denominator is this urge to step up into their power and to really utilize their voice to speak up and share the stories of struggle of what our communities are going through and what they're seeing firsthand, how their coaches are being deported and picked up at their soccer games, how they're seeing firsthand how their neighbors are being taken away and the kids are left behind crying. So all of this trauma, I see it played out through my childhood, and it makes us so much bolder. It gives us that strength to continue pushing, especially in these types of injustice and these types of criminalization and these types of discrimination, that we as organizations can continue to play defense and offense, right? For our young leaders in our community and our organization at TODEC, our offense, our defense continues to look, know your rights, organizing grocery distribution since March of 2025 to impact the families, that has been led by these young leaders, right? How they are not only fundraising, they have been organizing packing groceries and distributing to our impacted families that are scared to leave their home. Similar, we all respond as organizations with our heart, similar to la compañera Janet, but this is not the first and it's not the last. And that's why we are so hopeful that our young leaders, and we're seeing it, how they took over the streets, right? How they created their own marchas, their own pickets, right? We saw this really early on in this year. And we are seeing this new pipeline of leaders, that they're not taking things lightly. Our offense at TODEC, we know that we can't just be playing defense all the time, which we are. Our legal services that we're providing and responding to communities' crisis, providing financial assistance to impacted families. Our offense continues to be civic engagement. And that's the only way, right? Because everything that we're seeing play out continues to impact the well-being of our community. In the Inland Empire, we continue to see how what Rudy's project they're doing in LA, we have been helping through our program in Centavito to create entrepreneurship with undocumented immigrants, because this started right after NAFTA, right? Because we saw the impact when we lost a lot of our fields in the Inland Empire, and our farm workers were left out with any safety net. Companies were not hiring them because they were looking at their immigration status, right? But fast forward, we are seeing now how even our warehouses that surround the inland are laying off workers. Why? Because of the fear of I-9 audits. So imagine a workforce that just wants to work, doesn't have access to safety net. They don't have access to nothing. Nobody wants to hire them. Entrepreneurship continues to be an offense strategy as well for us to continue keeping our community safe. But right now, our kids are really paying attention, right? Utilizing their voice to advocate, you know, and mobilizing for health for all in all our priorities as a community, but also utilizing for those that are able to vote, pre-registering at 16. So they're ready to vote at 18. Because trust me, right now, our kids, our youth, our young leaders are paying attention to everything that's happening, and they're educated, and they know that they just can't stay on the sidelines. They have to continue fighting and fighting, and all of us have to continue fighting without fear. You know, there's so much attacks against all of us, and we saw it play out with this beautiful event. But this is not going to stop us. Nobody's going to silence us, and that's why we have so much hope for our future generations, that they're taking it personal and they're not going to stop.
Thank you, Luz. That was really a powerful reminder of the power of civic engagement. You know, last year at our summit, we said health is on the ballot, right? And it's a reminder for us that if we are able to, and we have the ability to vote, right? Thinking about health as one of those pieces that brings us and our priorities up to the ballot. So we've heard so much happening. There are funds happening, there's mutual aid, there's clinic services being provided that are not funded by anybody but the clinics themselves. And so I want to turn us, as we're getting nearer to our time, to think about sustainability for this work. We talked about the rapid response. We talked about what our new normal is. And so, you know, one of the questions that I have for each of you, and I'll start with you, Janet, so giving you a little warning, is what does sustainability look like, and what do you all need as leaders in your organizations to continue to sustain the work, the programs, the mutual aid? And this is, you know, if you have everything in the world, right? If someone could drop $1 million in your lap, maybe that's what you need. It's the $1 million question, because we could use $1 million. So Janet, I'm going to start with you. What does sustainability look like at Cielo?
Yeah, I mean, I think hearing everybody, right, and their different expertise, I appreciate it so much, because it really puts into perspective how we're seeing that there is a real push, one, to make communities who are immigrants, migrants feel othered, right? Through the health cuts that we're seeing, through the financial stuff that we're seeing, like Rudy mentioned, the banking, right? Trying to leave people without access to banking, but also like the resources, what we're seeing, the cuts to food pantries, right? Food banks. We're seeing cuts to healthcare. But we're also seeing a move in language, right? We're seeing that English is made the official language recently, right? As well, because this is also now a fight that we're seeing this week with the administration holding back funding to California, with the pretext of saying, hey, these truck drivers are not English proficient, so now they're trying to hold back the transportation budget. So I think that we're seeing these different attacks coming strategically, and I think that that's how structural racism is meant to work, right? To attack different forms, to attack communities of color and these different forms and these different systems that we have in place. And then when you add on top of that, the rates and having people live in anxiety and terror consistently, it really falls, unfortunately, on a lot of CBOs like St. John, like Inclusive Actions, like Todes, like Cielo, to really try to meet the community and the needs and the holes that are being created by the federal government to see how we can respond. So my ask would be, right, there needs to be this is the time that specifically funders need to invest in these CBOs, right? This is not the time to be afraid and pull back funding. This is not the time to say, hey, the federal government is, you know, investigating big foundations, because they are, right? There was like 2-3 weeks ago where Trump, the administration was looking into Soros, right, and their money and where it was going. I think that this is a time to really call on our allies to step up and fund the CBOs in the work, and not to be afraid to support immigrant rights organizations or organizations that do these different works that kind of plug a hole, right? Like we're trying to plug all these holes that are coming out, all these water spouts, right? To create sustainability in the organizations and the different organizations that are trying to address the situations as they're coming out of the federal government. So I think that the ask is, right, to continue the investment in the organizations. And I think for Cielo specifically, we have the food pantry, and we're continuously doing that. And we've done that since the COVID-19 pandemic. And so that's like one of the research that we want to do. But we also, like, if we were to ask a big ask, right, like you're saying, is like, you know, to have another building where we create a market food pantry where people can go in and select and do this kind of selection on their own of what they would want, to be able to operate it like 7 days a week in order to be able to provide these resources to people. Because I think that, like, one of our basic human rights is to have access to food, and that's looking really precarious these days.
Thank you, Janet, and for that reminder of just the access to food, one of our social determinants of health, as we've talked about. Rudy, I'm going to go to you next for the sustainability question.
Rita, I hate this question. I think that every time a funder says, how do you make your program sustainable? How do you make this work sustainable? How do you scale it? All these buzzwords, and none of us really define in the same way. Sustainability is about, to me, this is the way that I define it, Rita. Sustainability is about relationships. And when someone says, how are you going to make this sustainable? They're basically saying, this is a transaction. I don't intend to be here with you in solidarity for a very long time, and figure it out on your own. That's not the type of future that I see. And so my response to questions like this and to others, this is not about you, Rita, by the way, I think we're on the same team, is that I think that all of us should work together to redefine what sustainability is. I shared with you this letter from Senator Cotton. How would any of us have known that this guy is going to come to take down the pillars of our financial services system? Like, how do you plan for that? And so how do you fund that work and make it sustainable? I think what's required right now is a radical solidarity where we're all really leaning into each other, building strong friendships that are going to last the test of time. And sometimes you're going to be able to get resources to people. Sometimes you won't be able to, but you're still going to be together, speaking out for each other, problem solving together. So like, that's the type of sustainability that we're trying to cultivate with our funders and our investors, is like, bro, I don't want you to leave next year. I need you to stick with us. I need you to give us money every single year. But deeper than that, I want us to have a friendship. I want us to be really tied with each other, you know? So it's an invitation to all of us to think differently about sustainability. There's no way I could create a business to solve income inequality and like give you a business plan for that. It's like ridiculous. And so as I'm getting older, I'm surrendering that expectation. So if a funder asks me that, I'm just saying I'm not going to be able to meet that expectation for, friend. So.
Well, I love that you turned that question on its head. You're testing our friendship right here, but that's okay. That's okay. It's just giving you a hard time, but I love it. Thank you, Rudy, for flipping the script on how we need to think about this question of sustainability, and that's unity and being together for the long term. Jim, I'm going to turn to you now to think about what it looks like from your vantage point.
So what Rudy said really resonated with me. I feel very much that we need to challenge the definition of sustainability. And I really believe the way that we sustain is to fight back, that we have to defy, we have to live in defiance of what we're seeing before our very eyes, the horrific, unconstitutional and inhumane violation of the basic human rights of millions and millions of Americans and people who live in this country. So I really believe what sustainability means is to push back on the governor and the legislature on where on the one hand they're saying, oh, we're against these raids, and on the other hand, they're taking away healthcare services from immigrant families. I think we have to push back. California is a very progressive state, and yes, there are pockets of reaction and conservatism, but the California Community Foundation did a poll that found that 58% of Californians support healthcare services and Medi-Cal for undocumented immigrants. And we've seen many polls where 60-70% of Californians oppose the raids and the deportations and the kidnappings. So I think we've got a base in California to build on, that we can fight these things. And obviously St. John's in our lane is health. And so we're going to fight to restore the cuts to healthcare services for immigrant for our immigrant communities. And I think we all have to lock arms and defy what's going on and fight back. That's what I really believe we have to do to sustain.
That's beautiful. Well, thank you. And Luz, I'm going to turn to you before I have our final closure question.
Yes, at this point, that even that word sustainability is very layered. What comes to mind is that we need to exist in order to resist. Is for us, for our organization in the Inland Empire, it's funding has been a struggle, to be honest. We've been overshadowed by LA, San Diego, and all our neighboring counties for so many years. You know, I could share our organization's first decades of our life were volunteer, power of the people, right? So we've learned how to build that muscle that we're able to continue with our base of members and volunteers. But during these times, things have looked very different for the IE now, right? But we're still falling behind. The demand is higher, and it will continue to be higher, especially with all the oppression that we continue to experiencing. But what sustainability looks at in different ways for me. But at this point, if we're talking offenders, we need long-term commitment, unrestricted and general operating funds, because as organizations that we're responding to this crisis, we have to be nimble and we need to be able to shift as we need. Every day, different things drop, policies change, different attacks. So these types of operational unrestricted funding provide us the ability in order to respond to crisis, right? It could be food, it could be legal, it could be supporting a family in different ways. But what we are really looking at is right now intentional funding, because all our donations are going to our defense, right? To respond with food, with the different financial assistance and how we're responding to community. But we have to continue receiving funding and organizing. Without organizing and mobilizing and civic engagement, we're not going to have the power that we need to continue fostering within our youth, within our community, because everything that we're seeing is political. It's political. And if we don't continue, we're no longer the minority. And that's the fear that many folks have. But we need to continue building that muscle so we could continue fighting through, because if we don't create systems, how are we going to create justice? In order to create systems, we need to be organized. We have to be mobilizing. We need to be getting out within our civic duties to create that justice that we are all looking at and expecting, either health justice, economic justice, any type of justice, immigration justice. We need to continue building that power. And that's what I'm doing, a call of action to any people that have deep pockets to continue investing in organizations that are doing this crucial work and that are putting ourselves at the line for our community and putting ourselves at risk for those that are vulnerable and cannot speak up right now because of the fear of even putting their faces out, that are even in fear to mobilize to Sacramento, right? That we're utilizing our youth to represent their communities because they have a status. But even then, all of us are under attack with the Supreme Court ruling. Just by being the way we look or speaking the way we do, we're all under attack.
Well put, everybody. That's a lot. It was our hour together, our collective breath, as Seciah started out with the beginning. I want to do one lightning question to everybody. And I'll start with you, Jim. Y'all leaders of huge organizations doing a lot of really intense work. What's keeping you healthy and grounded? Maybe that's also a big question. Maybe it's just today. Maybe it's your matcha or your tea or whatever it is. Jim, what's bringing you grounded in health these days?
I think my extended family. You know, I'm a child of immigrants, and we have a very, very close extended family. And I think we provide a lot of support. We're a progressive bunch, and we're there for each other. That I get a lot of strength from that.
It's beautiful. Thank you, Rudy. I'm going to turn to you.
You know, I have a lot of little tips that I use to cope with my with life. But this morning, y'all, I woke up early, I went for a run, Rita, like I promised I would. I did some reading and I picked up this book that I've read like 3 times, and it just like, yo, I felt ready for the day. Put the link in the chat. It's by a Buddhist nun, Pema Chodron, Things Fall Apart. And the first chapter is called Intimacy with Fear. And yo, like, I was just like, this is what I need today. It's about, I need to build my capacity to be intimate with fear, because the fear is here. We're all afraid in some way. And one way to overpower that is to become intimate with it, to get to know it and to be okay with it so we can move forward. So I'll stop there.
Thank you. Janet?
I think what really keeps me grounded during this time is like checking in with community members. When we do the food boxes, is so nice to see them. It's so nice to say, how's your kid doing? How are you? How are they going off to college? And they really give me a lot of energy and hope. I haven't been in a couple of weeks, which is, I miss them. And then also like the team at Cielo, they're wonderful. They have so many bright ideas, so many fun conversations. And I think that when you love the work, it just becomes easy. Well, I don't want to say easy, but like easier, right? To digest everything if you have like a collective to hold you down and like to talk and to kind of like do the same work together. I feel like it helps shoulder the weight of everything a little bit lighter.
Thank you, Janet. Sensing a theme here with our people power too. Luz, what's keeping you grounded?
My faith, culturally, my faith keeps me strong in the good and the bad, and living all the traumas with community becomes our trauma, and it just becomes so emotional, but it gives us so much strength to continue pushing harder. I say my faith, and that's something that we check in with within our community, and as we're having community conversations, it's always about the faith, right? That keeps us grounded. But another something that keeps me grounded, it keeps me motivated, is the responsibility that we have as organizers to continue uplifting the stories, right? And I just want to share this story because it's my obligation, and I share it everywhere I go. One of the stories of one of our impacted farm workers in Coachella that committed suicide earlier this year because of the trauma of not having access to food, living in fear, right? I could share his story there. His family, the widow gave me permission, but those are the traumas that keep me grounded and our organization grounded. And we need to continue using our privilege to continue fighting for those that don't have the privilege that we all do. But I say faith keeps us sane, even if we're going through bad times. But this family, taking a little bit more time, the wife decided to just leave to their home country, to the state of Michoacan. And that's where they have to be, taking their kids that have never been there has been a real culture clash as well. So just keeping all these community members in our prayers and keeping all of us together, that keeps me sane and grounded.
Thank you, Luz, for sharing that. I want to do another breath. We take a moment of silence to honor those who have left us for various reasons. Thank you. Thank you for bringing his memory into this space. And again, I think we want to close on that note of a beautiful conversation. I know this was a hard conversation, hard moments, but this note of unity in community, remembering those, being an ally and stepping up where we are. And I hope that that grounds us in our conversations for the rest of the day. I've had such a privilege moderating this panel. I want to thank Janet, Luz, Jim, Rudy. Thank you all so much for your time. Thank you, viewers, for your time. And we'll close with that. And Jocelyn, I'll pass it back to you.
Thank you so much to all of our panelists today for being here with us today and for all of the work they do. And as difficult as these conversations can be, it's important that we know the realities and challenges our immigrant communities are facing, especially related to mental health and healthcare access. And thank you for leaving us with some powerful reflections about what is needed to continue to move this work forward. It was really neat to hear, at the end, your reflections on what keeps you grounded and what keeps you sane. And all of you, it came down to people. And I think that that's such a telling thing of who we are as a community, as Latinos, that we care for each other, that we want to work together, and that it's the people that keeps us moving forward. We've had such a great morning together, but I know that many of us are maybe getting a little hungry, especially with all of this knowledge and all of these powerful conversations that we are having. But before we head into lunch, I want to welcome a virtual message from Yuyi Morales, author of the book Bright Star. Yuyi Morales was born in Jalapa, Mexico, the city of flowers and springs. After migrating to the US in 1994, she struggled with English and loneliness in a culture foreign to hers, but found solace in public libraries where she read children's books with her son and discovered a renewed interest in stories and art. She is now the author and illustrator of many books for children, including the New York Times bestseller Dreamers, and her most recent book, Bright Star. She is a 7-time winner of the Pure Belpré Medal for an outstanding work of literature for children that best portrays, affirms, and celebrates the Latino cultural experience. Our goal today in inviting Yuyi is to help us do just that, for us to be able to celebrate our culture and go back to that childlike wonder that can help renew our hope and resilience. So let's see her message.
My name is Yuyi Morales y desde Jalapa, México, les mando muchos saludos. I love making books, telling stories with words, with drawings, and today I would love to share with you one of my books. This is Bright Star. Would you like me to read it for you? Bright Star, by su servidora, Yuyi Morales. We begin with this blanket. Can you find the little ant? Child, you are awake. Breathe in, then breathe out. Hermosa criatura. You are alive. You are a bright star inside our hearts. Mira, some things you can see, other you must find. See if you can find the black grasshopper. What about la codorniz? What about the black widow spider? Can you find it? So you search. You are ready, cosita pequeña. Let's go, vámonos. And here she goes, this little venadita, jumping to join her mother to begin their journey. Oh no, what is that? Look and listen. Be alert. Can you see that something is happening? And that all the animals are alert? Is Venadita alert? I think she's looking at her mother because she knows that mom will tell her what they need to do next. Te amo, corazoncito tembloroso. Breathe in despacito, then gently breathe out. Lie low, we want you safe. No matter where you are a bright star inside our hearts. Can you see Benedita? How do you think she feels? And if you feel afraid and you begin to hurt inside, let it out. Shout it loud. Let the world know what you feel. No! The earth murmurs your story. We are here to protect you. You are not alone. Listen. And if you could hear this page, what do you think that you could hear? Perhaps the whoosh of the wind blowing the feather, or the pling, pling, pling of the rain that is coming down. Or what about the flapping of the wings of the bats? All mothers coming from Mexico all the way to the border to have their babies. Or what about the crack, crack, crack of the mariposa cuatro espejos coming out of its cocoon? Sometimes silence tells you secrets. Could you see the secrets? Could you see the mom nursing her baby? And what about another mom that is carrying her baby while she's eating pollen from the flowers? And you imagine a new story. You imagine the most beautiful world. You are a bright star inside our hearts. And if you see these children, can you see that they represent the animals inside of this story? See if you can recognize them. And for now, this story is over. But the story of immigration is never over. The story of Venadita and all the little venaditos y venaditas que cruzan la frontera is not over yet. When I made this book, I was hoping that I could somehow be a companion, especially to those children who are in the experience of crossing the border or being separated from their families or the people that they know because of the immigration policies. Things haven't changed. We need us more than ever. And in this page where you see the snake and the jaguar, this is a page that is always like a reminder to all of us, to me, to ourselves, that to take care of our family, our children, and anybody who is in a situation of being separated, being in detention, or having to suffer the consequences of the immigration policies, that in order for us to protect those people, especially the little ones, we need to summon the strength of culebras y jaguares. We are gonna need it so that we will never leave alone those that need us. Together we can do it. And to the LCHC people right now, I just wanna say, California presente. Nuestros corazones siempre en resistencia.
Muchísimas gracias, Yuyi. What a beautiful message and story, especially as we have closed out our first panel conversation. We are all bright stars in this world and in our community. With that being said, we will now break for a little lonchecito. Please enjoy, and I will see you back in at 1:17 p.m. Our second panel will be beginning at 1:19. So we will see you back in about, 30 minutes. Enjoy your lonche, and we will be back soon.
Mushkina. Black of peas came to make it hotter. We beat the fire starter. Bubbling up just like nah, penetrating through your body armor. Rhythmically we massage ya. With hip hop mixed up with samba. With samba. So yes, yes, y'all. You know we never stop, we never rest, y'all. The black of peas will keep it funky fresh, y'all. And we won't stop until we get y'all. Till we get y'all. Say it. Pick peppers, but I rock rhymes. 1, 2, 3, 4, several times. Heavy rotation played by every kind. Radio station blessing every mind. We crossing boundaries like every day. And we won't stop until we get y'all. Till we get y'all. Say it. Be my daily operation. Gotta put in work in this crazy occupation. Gotta keep it moving. That's the motivation. Gotta ride the waves and keep a tight relation with my team. Keep it moving and doing it right. Up in the lab every day till daylight. That's the way things move in this monkey business. We took an old samba song and remixed it.
Sai da minha frente que eu quero passar, pois o samba está animado. Eu quero é sambar. Este samba que é misto de maracatu. Samba de preto veio, samba de preto tu.
Mushkina.
We gon' make you feel hot. The beats and such your mendes eating up samba.
Sergio play your piano. Sergio play yo. Yo, 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 yo. Piano, wano, 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 wano. Check it out. desesperado, una cartica que yo guardo donde te escribí, que te sueño y que te quiero tanto, que hace rato está mi corazón latiendo por ti, latiendo por ti. Aquí yo guardo donde te escribí, que te sueño y que te quiero tanto, que hace rato está mi corazón latiendo por ti, latiendo por ti. Ella es la favorita, la que canta la zona, se mueve en su cadera como un barco en las olas, tiene los pies descalzos como un niño que adora, y sus cabellos largos son un sol que te antoja. Le gusta que le digan que la niña la Lola, le gusta que la miren cuando ella baila sola, le gusta más la casa que no pasen las horas, le gusta Barranquilla, le gusta Barcelona.
Llévame en tu bicicleta. Óyeme, Carlos, llévame en tu bicicleta. Quiero que recorramos juntos esa zona, desde Santa Marta hasta la Arenosa. Llévame en tu bicicleta, pa' que juguemos por la tapa y en chancleta. Que siempre que algún día le muestres el Tayrona, después no querráis ir pa' Barcelona.
A mi manera, descomplicado, en una bici que me lleva a todos lados, un vallenato desesperado, una cartica que yo guardo donde te escribí, que te sueño y que te quiero tanto, que hace rato está mi corazón latiendo por ti, latiendo por ti. Aquí yo guardo donde te escribí, que te sueño y que te quiero tanto, que hace rato está mi corazón latiendo por ti, latiendo por ti.
Llévame en tu bicicleta. Óyeme, Carlos, llévame en tu bicicleta. Que siempre que algún día le muestres el Tayrona, después no querráis ir pa' Barcelona. Llévame en tu bicicleta.
mamá me dijo que sembrara flores, que saliera al campo a buscar amores. Mi mamá me dijo que sembrara flores, que saliera al campo a buscar amores. ¡Ay! Sí, 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 sí. No, 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 no. ¡Ay! ¡Uy! ¡Ay! ¡Uy! Ya llegó la campanera, es del campano costa colombiana, la mujer más cumbiambera que tiene la costa de la sabana. Esa negra campanera anda buscando al tigre sabanero pa' que le toque el campanero, porque ella quiere bailar en la cumbiamba. Salió de la costa colombiana para Nuevo Laredo y Monterrey, va para la costa mexicana a bailar cumbia hasta amanecer. Acapulco y en San Marcos Guerrero, ella dice que allí mero se queda para ver quién son los cumbiamberos que le aguanten a la campanera, porque ella es peligrosa con su movimiento de cadera.
Y a los hombres que agarran temblando los deja,
Ella quiere bailar por todas las costas de Guerrero,
porque sabe que son bastante cumbiamberos.
hay en la costa chica y en la costa grande la negra.
A una rueda de cumbia va la campanera,
Hay en la costa chica y en la costa grande la negra.
va a bailar la cumbia la negra campanera.
Uy, 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 negra. Y dice, ay, uy. Y Víctor Mata, movimiento. Movimiento negra. Muévete, muévete, Mónica. Ay, uy, sí, sí, sí. Porque ella es peligrosa con su movimiento de cadera.
Y a los hombres que agarran temblando los deja,
Ella quiere bailar por todas las costas de Guerrero.
porque sabe que son bastante cumbiamberos.
Hay en la costa chica y en la costa grande la negra.
A una rueda de cumbia va la campanera,
Hay en la costa chica y en la costa grande la negra.
va a bailar la cumbia la negra campanera.
Muévete, muévete, negra. Sí, 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 sí. No, 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 no. ¡Hey! ¡Hey!
Tú nos dices que debemos sentarnos, pero las ideas solo pueden levantarnos, caminar, recorrer, no rendirse ni retroceder, ver, aprender como esponja absorbe. Nadie sobre todos, faltan todos, suman todos para todos, todo llevas. Ni África ni América Latina se suba. Con barro, con casco, con lápiz a patear el fiasco. Provocar un social terremoto en este charco. Del cielo al suelo y del suelo al cielo vamos. Caballito blanco, vuelve pa' tu pueblo. No te tenemos miedo, tenemos vida y fuego. Fuego en nuestras manos, fuego en nuestros ojos. Tenemos tanta vida y esta fuerza color rojo. La niña María no quiere tu castigo. Se va a liberar con el suelo palestino. Somos africanos, latinoamericanos. Somos este sur y juntamos nuestras manos. Todos los callados. Callado.
voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. El cariño que te tengo no te lo puedo negar. Se me sale la babita, yo no lo puedo evitar. Cuando Juanita y Chan Chan en el mar servían arena, como sacudí el jibe, a Chan Chan le daba pena. Limpia el camino de paz, que yo me quiero sentar en aquel tronco que veo y así no puedo llegar. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí. De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarí.
Ladies and gents, turn up your sound system to the sound of Carlos Santana in the GMB Ghetto Blues from the refugee camp.
Maria, Maria, she remind me of a West Side Story, growing up in Spanish Harlem.
Hola, hola, mi gente. Welcome back. ¿Cómo se sienten? ¿Cómo les fue de lonchecito? Como dicen, ¿cómo es panza llena, corazón contento? Ya estamos listos y llenos de energía to continue with our second panel. We have prepared yet another timely and important conversation, this time related to Medi-Cal. Salva mi Medi-Cal, examining the status, challenges, and opportunities for California's most extensive safety net. This panel will be moderated by LCHC's Director of Policy, Mar Velez. I'd like to welcome our panelists and moderator. Y mi gente, we also want to remind you to keep interacting with the Padlet app. And also thank you for all of the emojis, all of the comments, and of course, all of the support we have been receiving on the chat here. And also, I want to remind you that we also have the Q&A option at the bottom of the screen in case you have any questions for our panelists or moderator. All right, Mad, please begin when you are ready.
Thank you so much, Jocelyn. It's a pleasure to be here with everyone. Saludos, greetings to everyone that's tuning in to LCHC's 2025 Summit. If we haven't met, my name is Mar Velez, Director of Policy with LCHC, and I'm really excited to be having this conversation with you all on one of the Latina and Indigenous community's most important programs, Medi-Cal or Medi-Cal. So I just want to also start off by saying that in the previous panel, really appreciate all the speakers really providing that lived experience. And we heard about, how our communities are dealing with the federal impacts and attacks. But I also heard something else, which is that we also need to look at the systems, right? We need to hold these systems accountable. And so our conversation today, Salva mi Medi-Cal, examining the status, challenges, and opportunities for California's most extensive safety net, is going to be looking at just that, at the system that is upholding the Medi-Cal program. So I want to start off by saying that, the state federal healthcare program, Medicaid, or as we know it here in California, Medi-Cal, has undergone many changes in the last decade to provide healthcare to many low-income individuals and families across the nation and here in California, including to families regardless of immigration status, many of whom are Latina and Indigenous. And this movement is known as Health for All, the idea that everyone, regardless of where you were born, of the color of your skin, you deserve healthcare access. But of course, we are living in different times. With the federal administration instituting new exclusionary policies that limit the access to Medi-Cal for more immigrants, and our state facing its own budgetary challenges to fund expansions. No other state stands to lose more in terms of advancements in health equity, including the Health for All expansions, than we do here in California. LCHC launched our campaign, Salva mi Medi-Cal, a public bilingual mobilization campaign as a response to these threats. But as we continue to advocate to save the program for all Californians, we are at a particular moment in California's ability to provide healthcare access through Medi-Cal. Here to help us discuss the challenges and opportunities within Medi-Cal and beyond are an incredible set of speakers. So with us today, we have Alondra Mendoza, community advocate with the Mixteco Indigena Community Organizing Project, or also known as MICOP, Francisco Silva, CEO of the California Primary Care Association, Diana Camacho, Senior Program Officer with the California Healthcare Foundation, and Carlos Marquez III, Executive Director of the County Welfare Directors Association of California. So welcome to all our amazing panelists. Before we get into the conversation, I just want to provide the audience a reminder to submit any questions that you might have through the Q&A function, and we will have an opportunity for questions towards the end of our conversation. So with that, I'd like to start off with you, Diana. I'd like to see if you could please ground us in these policy changes that are impacting the Medi-Cal program. How will the federal bill, HR 1, be impacting access to Medi-Cal for Latina and Indigenous communities? And how is CHCF thinking about the implementation process at the state level? And of course, additionally, what was included in the state budget bill this year, and how will that be impacting access to Medi-Cal for us here in California?
Thank you very much, Amara, and thank you to LCHC for your leadership on healthcare access and creating the space for us to speak about what is a literal lifeline for Latino Californians, Medi-Cal. I'm gonna get a little wonky here and talk about some Medi-Cal policy, but I really want to start by saying I'm just truly honored to be here side by side with so many Latino champions for health when our communities are being threatened to our core. It's quite a privilege. So next slide, please. I want to start by really just highlighting the importance of Medi-Cal to Latinos in California. What you see here is a chart that really shows that while employer-sponsored healthcare is still the biggest source of coverage for Latino Californians, Medi-Cal covers about 1/3 of Latinos in the state. What you're not seeing on this chart is that while Latinos are about 40% of the state population, they represent 50% of the Medi-Cal program. So when we talk about cuts to Medi-Cal, we are talking about cuts to Latino access to care. I'll also note, you'll see on the very bottom and the pie chart that amongst Californians that are uninsured, which is actually at historic lows, they are predominantly foreign-born and US-born Latinos. With changes to Medi-Cal, we can expect, unfortunately, this uninsured rate to go up. So next slide, please. So just a little federal and state context, which frankly is changing often before we talk about the specifics of Medi-Cal. The federal and state cuts to Medicaid are significant. The federal bill that cut Medicaid, HR 1, decreases spending on Medicaid by almost $1 trillion, which is about 14% of the Medicaid budget overall. As we have discussed earlier today, these federal cuts put tremendous pressure on states since Medicaid is a joint state and federally funded program. I've seen lots of different estimates, but it's estimated approximately that California will lose more than $30 billion annually in federal Medi-Cal funding as a result of these federal cuts. As a result, we know that Medi-Cal coverage will decline. People will lose Medi-Cal. And there's different estimates, huge ranging estimates from 1.6 to over 3 million people will lose Medi-Cal. And these cuts we know will have significant impact on how our safety net is financed. So community health centers and those who provide care for these communities will lose funding. I know Francisco will talk about that more later. And aside from these cuts and people losing coverage, there's lots of policies being enacted that are really restricting the way that these essential community providers are able to care for these communities. I won't speak directly to those today, but the threats are coming from every angle, frankly. Next slide, please. So to talk about Medi-Cal, at the federal level, there's kind of three big things I want to point the audience towards. The first is work requirements. So the mandates, the changes around work requirements will require Medi-Cal members to demonstrate 80 hours a month of participation in certain activities like work, volunteer, or caregiving in order to stay enrolled in Medicaid. There's a number of exemptions to these work requirements, but even with those, it's estimated that 3 million Californians are expected to lose coverage because of work requirements. Aside from the impact on Californians, I really can't stress enough how big an administrative lift implementing work requirements is going to be for the state. It's a very short window in which these need to be implemented. It's really complicated. It's going to be very costly to do this work. And frankly, the full impact of these changes will really depend on how CMS at the federal level interprets, implements, and monitors these new requirements. The other big impact will be the requirement to redetermine Medi-Cal eligibility every 6 months. It has been annually with lots of automatic renewals, and even during the pandemic, there was a pause on this altogether. Due to this requirement, it's estimated that 400,000 Medi-Cal enrollees will lose their coverage. Another significant thing that HR 1 does is reduce retroactive Medi-Cal coverage from 3 months to 1 month for ACA expansion adults and 2 months for others. What this means for everyday Californians is that they're likely going to have more unpaid medical bills given that their Medicaid will not be retroactive. So as I mentioned earlier, all of these federal cuts put a tremendous amount of pressure on the state budget. And as we've all been discussing today, state cuts are targeting our state's immigrants. Because of the freeze that will happen on January 1st of 2026, that will not allow new adult immigrants to join the Medi-Cal program, 1.6 million immigrant Californians could lose their coverage as a result. And we also know that starting in July 2027, if they're able to stay enrolled, meet the work requirements, jump through all these tremendous hoops, they will be required to pay a $30 monthly premium, which is not insignificant. So next slide, please. There's a lot of dates and data on this. I won't walk through everything, but what I just really wanted to call out here is that all these state and federal changes are happening between now and 2028. So what that means is there's still time for things to shift. And there's still a lot that we don't know about how the federal government and the state, frankly, will implement these changes. I also wanted to touch, next slide, please, on, I know we're talking about Medi-Cal, but I wanted to touch quickly on Covered California, because this is the hot topic at the federal conversation related to the shutdown. We know that Covered California covers about 2 million Californians, a large share of which are Latino as well. HR 1 also eliminated enhanced premium tax credits for the marketplace enrollees, which would essentially mean if you were below 400% of the federal poverty level, it capped how much you could pay on your monthly premium. So for example, if you were an individual making, say, $28,000 a year, you wouldn't pay more than around $300 a year for your coverage. With the expiration of these tax credits, you could pay, that same person could pay over $1,500 a year towards their coverage. And that's going to have big impacts on the finances of Californian families who already cannot afford healthcare. Right, HR 1 also eliminated these premium tax credits for lawfully permanent residents. It excluded DACA recipients for enrolling. We're hearing at the federal level that Republicans are beginning to develop a framework for thinking about extending these tax credits, but not until after the shutdown is over. So this is really in the middle of the shutdown conversation. Next slide, please. So in all, really significant impacts to healthcare access and coverage, especially for Latinos in the state who benefit from Medi-Cal. And unfortunately, we have been here before. As we look forward, I also want to encourage us to look back. As many have stated before, we've been expanding coverage to Californians since 2010 and before. And there were many patchwork programs that existed in California before the Affordable Care Act that provided Californians with low incomes and those with undocumented statuses to have access to care. To be honest, these programs were not ideal, and we all agree that full scope Medi-Cal needs to continue to be the goal that we get back to. But in the interim, these programs represent models that we can build off of to ensure that people do have some access to care that can save their lives. I want to point you to a paper that CHCF published that outlines these types of programs and considerations for thinking about how we continue to cover the uninsured going forward in the future. And it highlights state programs, it highlights county programs, and other innovative models that were developed around the state before the ACA and before we had expanded Medi-Cal for our communities. So check out that paper for more information about these and other considerations. Thank you very much.
Thank you so much, Diana. Really helpful to ground us in what those federal and state policies are that our systems are having to deal with very soon in terms of implementation. I do have one quick follow-up question, if that's okay. Are there any mitigation strategies available to California that reduce the harm of HR 1? Anything that you'd like to highlight as we get into the implementation conversation and how the rest of our panelists are looking at this as well?
Yeah, thank you for that question, Mar. And I just want to reflect on the fact that this is obviously not where we all want to be in the conversation we want to be having. And there are things that we can be doing, as you note, to mitigate the harm. So until we get back to kind of full scope Medi-Cal for all, health for all, we really need to be thinking about what programs we can support and finance that will provide care and coverage for those who are losing coverage, including immigrants. So that's the first thing. The second thing is we also need to make sure that those who are enrolled stay enrolled. This includes outreach, education, enrollment support to help people with things like redetermination, work requirements, and frankly, weighing the benefits of coverage for those who are undocumented or worried about data sharing and their safety. So really needing to hold people's hands through this, this next set of changes. And while not directly related to coverage, I think this is a really important time to remind ourselves that we need to meet people where they are and build trust and increase access to care, given the fears that we've talked about all today. This includes healthcare in particular, thinking about things like telehealth to meet people where they are if they're afraid of accessing care in person, mobile clinics, the use of promotoras, and other ways to build trust with Latinos during difficult times to ensure they continue to have access to life-saving care. So there are things we can do until we get back to where we need to be. And I have faith in our community's resilience and ability to do so. Thank you, Mar.
Yeah, of course. Thank you so much, Diana. And I think that that is a perfect segue over to Alondra here. So Alondra, bringing you into this conversation from where you sit, I know your title is community advocate, but I also know that you've played a really important role with the Indigenous community as a promotora de salud. And so want to bring you in here to see if you could share a little bit about, we heard about these policies, which are overwhelming, but how are you and your community that you serve, how are you seeing the impacts already? I know that, some of these haven't gone into effect just yet, but how are you all looking at this right now?
Yeah, thank you, Mark, for that question. Before I start, I want to share a little bit about our organization. MyCup is a community-based organization that works to support, organize, and empower the Indigenous migrant communities in California's Central Coast. And we envision a strong Indigenous immigrant community actively engaged to achieve just working and living conditions, equality, and full human rights in the broader community. Always grounded in language justice, in community trust and cultural respect. And MICUP has had a long trajectory in serving the Indigenous Mesoamerican community and has been around for 24 years. Since the beginning, our focus has been on health access, food equity, and language justice. The organization was funded by Sandra Young, a family nurse practitioner who saw a need for culturally and linguistically accessible services for Indigenous pregnant women who were largely migrating to Oxnard from Oaxaca, and since grown to serve other Indigenous communities such as Zapoteco, Purepecha, and others. Before I continue to answer the questions, I'd like to give a special shout out to my colleague Juana Zaragoza, who is our health navigator manager. And as you know, the federal administration is making drastic cuts to Medicaid. Many families will lose access to Medi-Cal, as Diana mentioned already. And at the state level, the Department of Healthcare Services, DHCS, is implementing an enrollment freeze for all adults from 19 years and older. And over the last 3 years, our health navigator team and our health advocacy team has helped thousands of community members enroll, renew, and understand their medical coverage. MICO provides support in Mixteco, Spanish, and English. And for those of you who don't know what Mixteco is, it is a language that is pre-colonial from the state of Oaxaca, where I am from. And because our language has been traditionally oral, people can receive information in the language they understand and trust. Whether it's helping them apply for the first time or walking them through renewal, we make sure they understand their options clearly. And if they don't know how to read and write, we help them fill out their application. Recently, we've been receiving many questions from community members about the medical cuts and upcoming changes. We're informing people that now is the time to apply for Medi-Cal if they haven't done it yet. because due to the medical freeze, the upcoming medical freeze. This means that a lot of, that for us in Indigenous serving organization, we have to do double or triple the work to ensure that our community is not left out from health coverage, healthcare coverage. And we believe that health coverage is a human right. We will also have to do work to ensure that community members reapply their Medi-Cal application every 6 months during their enrollment. And this is critical work. If we don't do it, no one else is going to inform our community members in their preferred languages. I also want to share some words from our health navigator manager in Ventura County. She says, many people are still in disbelief and hoping things will change. Some don't believe the new $30 premium will happen, while others say that they'll pay it if it means keeping their medical. For many, Medi-Cal is a lifeline. They want it in case of emergencies like needing an ambulance, medication, among other essential things. Because without it, the bills can be anywhere from $500, $1,000 or more. As health advocates in health policy, we're also seeing a gap in awareness. Many medical recipients are not familiar with all the benefits available to them. For example, the oral health and other preventative care, simply because they have never used it before. And that's why outreach and education is so critical. In our Camino a la Salud program, alongside my colleague Juan Carlos Diaz, we host a bi-weekly radio program on Radio Indigena 94.1 FM with a program called Tu Voz, Tus Derechos, Your Voice, Your Rights, to share health and public policy updates with the community in Mixteco and Spanish. And adding to these challenges, we recently experienced a major immigration raid in Camarillo and Carpinteria, where more than 300 people were detained by ICE. Community members are hesitant to visit our office, and we've shifted to following up with them by phone to support them with their medical applications, as well as other organizational programming. I want to close my thoughts by sharing the concerns of our community. Currently, people are also sharing concerns about long wait times to see doctors, limitation in healthcare services, including both preventative care and urgent care, as well as providers telling them that there are not enough doctors or specialized doctors to meet their healthcare needs. There are fears of encountering ICE at the hospitals. And these barriers create a real fear and hesitation. And for families, sadly, even having coverage doesn't always guarantee access to care. Especially in this time, we must continue to stand together in the fight for health for all, regardless of our community's immigration status. Thank you, and I'll pass it back to you, Mar.
Thank you so much, Alondra. I'm so honored to be, a partner of MICOPS and appreciate all the work that you all are doing to ensure that Indigenous communities have access and actually, go and get care. It's one thing to have access, but do people feel comfortable actually accessing that care? And so really appreciate all the work that you're doing. I think it's important for us to recognize that MICOP, even before all of these policy changes and new limitations to the Medi-Cal program, MICOP had already been identifying a really important gap that was preventing Indigenous communities from accessing that care, which is the language access piece, right? And so, you're doing so much work with the community to get them to the actual, point of accessing that care. And then here comes these policy changes. So it's really important that we recognize just the different stressors, right, that we're all dealing with, that you all are specifically dealing with. And so with that, I want to bring in Francisco here, because I think you're sort of on the other side, right, of this piece that Alondra is really speaking to. You are the clinics, right? You're where folks are getting that healthcare access. And so from the service provider perspective, Francisco, can you tell us what role do clinics play in the story of Medi-Cal and its ability to provide healthcare access to Latina and Indigenous Californians?
Thank you, Mar, for that question, and Alondra for that framing. And I'd like to end on that piece, right, where in this moment in time, we have to be really focused on making sure people have access, not just coverage. And the federal policies are making that more difficult. I think that's what they're trying to attack, where coverage doesn't mean access. But I'll finish with that and start, Mar, with some context of the role of health centers. And just very briefly, the Medi-Cal context is really important. Where Medi-Cal goes, the health centers go. About 1 in 4 Californians get their Medi-Cal care at a health center. 54% of our patients are Latino. 38% speak their primary language is not English. And about half of the primary care visits, the Medi-Cal primary care visits at our community health center. So the impacts that Diana talked about in terms of the cuts hit home with us. And it's beyond Medi-Cal, because our mission as community health centers, the origin of health centers that were born out of the social justice movement, civil rights movement of the 60s. The founders of many of the health centers are groups like the Brown Berets, the Black Panthers, the Great Berets. During the AIDS epidemic, some of our health centers were born when that community was being ignored. So because of that, we have a public health approach to it, the communities and the word. So we're impacted by everything, right? So the subsidies on Covered California, that means that patient that now doesn't have coverage, our model is that we see everyone, regardless of coverage. But we had gone from a place of about 16% of Californians had no coverage, to about 4%, right? That's a huge shift. It also meant, back to Alondra's point, it meant that you had resources to hire more doctors and incorporate community health workers and promotores and promotoras into our model. Now we're seeing a place where it's changing, right? The resources are going to be tighter. What we've been doing in the moment, that where we play, I think health centers play a really important role in the community, is to shift and to be that place to provide know your rights, particularly for the immigrant community, to make sure that we're doing it in the language that people understand, and working with community leaders that have trust, right? That's so critical right now. So a lot of health centers have shifted to making sure that patients understand that they're going to a safe place. It's meant incorporating and doing trainings on how do you react to ICE. And we've had many instances where ICE shows up to a health center, and the health centers are ready, right? You create a safe space, you close the doors, you ask for the warrant. So there's been a real shift in that regard. Some health centers also shifted to telemedicine, and making sure people understand that you can access care through telemedicine. And we have other health centers that are going out and making house calls, old school medicine, to make sure folks are trusted, are seeing us somewhere that they're getting care that's trusted. In terms of challenges, just to frame it for us, the part of the challenges that I think are key for health centers to play is that trust. Back to that, Londra's point, if you have coverage, but you feel you can't access it, then it doesn't mean anything. So that's an additional responsibility that health centers feel that we need to fill. That we are a trusted place historically for the immigrant community in particular, and for Latinos in particular. And it's so as we're looking at these different policies, if when the data, the health center, so it's got to inform the policies that we engage in. When the data about immigrants was shared with ICE, right, there's real concern that's going to create a chilling effect for folks. The fact that the state is freezing coverage for all. The proposal is to cut the PPS payment for health centers. And so you're taking the primary care resource away, which means we're still going to see people, but if you're shifting money away, means people have to wait. Back to Alondra's point, we're shifting to a point that if we don't have the resources in the safety net, it looks and feels like rationing. So the safety net, our role is to making sure people have care regardless of their coverage. And that's a responsibility we have to move forward because people may make the choice. And I think back to Diana's point, we want full scope Medi-Cal for everyone. But if people don't take it, how do we meet them? How do we still provide the care? It's going to be part of our challenge moving forward.
Yeah. Yeah, thank you so much, Francisco. Really seeing, the difficult place that clinics are in right now. As you're saying, clinics have been the sort of go-to access point for healthcare for many of our communities, Latinas, Indigenous, immigrant communities. And I really appreciate what you're saying, that despite the challenges, health centers are going to meet that need, right? You're not going to close your doors. But that also means that there is just added stress, right, on the system, the clinic community and system. So could you, I just want to sit with that for a moment.
Yeah.
And could you just provide us some insight in terms of maybe some institutional changes that you all are implementing or thinking about to meet this moment?
To be frank, right? I think one of the changes is, well, I wouldn't call it a change. I would say that it's taking out a tool that you didn't have to use for a while that you have to use, and I think part of it is being prepared for fierce advocacy to protect the community. And it's something that historically we've all done in coalition. And I think that's going to be critical. And just to give you a couple of examples, a couple of the threats I'm really concerned about is this effort around PRORA. What the federal government has done is they're trying to redefine what's considered a public benefit to prohibit health centers, clinics, the public health systems, and others from providing care to immigrants and documented immigrants in particular, but all immigrants, because they narrowed the definition of who's considered a quote unquote unsatisfactory immigration status. So people who have full legal status and rights to work here and be in this country now can access public benefits. There's a lawsuit on that right now. It's enjoined. I think for health centers collectively, we're prepared to be a fierce advocates for our community in that regard. And it's going back to the roots of the public benefit perspective, the public health perspective. If people don't have coverage, they're still going to need care, and they're going to end up in the ER. The other piece, operationally, we just have to be very focused on how do we protect our community, and that means protecting their data. And it sounds super bureaucratic or technical, but even in the way DHCS is coding how we provide a service is really important. We're strategically, we've always said we don't ask for immigration status because we don't want to be in a position where folks are identified. And even as the state is developing its programs, we got to be very strategic that way. Do we need people's address? If you don't, then let's not put it. So I think we're going to have to think of health coverage and health policy in a different way in California to make sure we're protecting our community. And in terms of pivoting, also on the ground, we had a really robust program before we had coverage for all, but it took years to build. And because we had coverage for all, if that goes away or people can access the coverage, we got to be prepared to rebuild that. Free clinics, we used to have a very robust network of free clinics. They've gone away because we didn't need them anymore. There was a good thing. And we had counties that had programs that were stood up. I think we're gonna have to revisit the county programs. And like to Diana's point, it feels like a step back. But I think the goal should be to make sure people have care, and particularly for our Latino and immigrant community.
Yeah, thank you so much, Francisco. And I think I'm hearing some bits and pieces of like what could Medi-Cal look like? How do we want to envision Medi-Cal in the future? And we'll get there. So I want to hold on to that. But Carlos, I see you here. We want to turn it over to you now. And of course, you representing the counties. We know that California is a huge state. There's many different kinds of counties. And so I think as we're seeing this Medi-Cal moment, we are seeing a huge shift in responsibility to the counties. But again, every county is different. What's top of mind for your members and the counties? How would you like to begin with this sort of piece around Medi-Cal?
Well, I just want to extend our gratitude, Mar and Rita, for inviting us to participate in this urgent conversation, and obviously to everyone who took the time out of your day to attend the conference under incredibly exigent circumstances, not just with HR1 and the federal environment, but some of the threats that we're seeing in our own backyard. So just appreciate the community here today. So I represent the County Welfare Directors Association, and we have 58 human service agencies in our membership, all 58 counties. Our directors administer safety net programs for our most vulnerable community members. That includes CalWorks, the welfare work program in California includes CalFresh, known as the Supplemental Nutrition Assistance Program federally. That includes Medi-Cal eligibility. That includes child welfare and child protection, and it also includes adult and protective services. So the work that we do on a daily basis impacts the full continuum of communities in California. The safety net is administered in different ways depending on the state that you live in. So in our case, in California, we have a state and federally funded safety net that is administered by counties. Some states administer these programs directly without county administration. So that's a key difference in California, which I think has played a role in some of the success that we've discussed over the last 10 years today around expanding coverage. Counties have really been embedded in a culture of coverage for the last 10 years, making sure that we're keeping pace with the new opportunities to cover particularly undocumented individuals and families. But most recently, over the last 5 years, making sure that we can keep as many people in Medi-Cal who benefited from coverage during the COVID pandemic and ultimately would have lost coverage during the unwinding period had counties not aggressively pursued redeterminations in that period of time. And so what we're asking counties to do at this point, primarily our administrators and our county workforce, is to essentially engage in a paradigm shift from a culture of coverage to a culture of restriction and compliance, which is very troubling. We've worked really hard to transition the county eligibility workforce from a culture of gatekeeping to a culture of ushering coverage. And so I think we're very much not trying to abandon that position, because we believe firmly that this moment will pass. with all of us doing the hard work of advocacy in the legislature and ultimately at the federal level. But counties are really kind of the confluence of so much that our federal government is throwing at our communities right now, particularly our undocumented communities, the communities that are documented and immigrant, but also, are here because of refugee status. They are asylum petitioners. They also no longer have some of the protections and access to benefits that they previously had under H.R. 1, as well as under recent interpretations around the welfare law that Francisco referred to earlier, Perora, that was passed in 1996. And so there's just a whole host of threats that are facing our communities. We know that because of interior deportations, our Latine and undocumented families are having to contend with potential family separation, which is increasing pressure on the child welfare system. We also know that we have to implement new restrictions around SNAP and CalFresh under H.R. 1, which means that some of those previously eligible humanitarian immigrant recipients are losing coverage. There will be people who lose food assistance coverage because of work requirements, and then ultimately there will be people who lose coverage because of work requirements on the Medi-Cal side. So the challenges are many, but what I want to really emphasize is that we've had our backs against the ropes in the past, never at this magnitude, but we have been able to persevere through strong partnerships with community-based organizations and folks who are embedded in community who have the trust of our most vulnerable and who can help them navigate this incredibly precarious moment in history. I also want to emphasize there's a ticking clock in terms of when people can actually enroll in Medi-Cal in California who are undocumented, and it expires on January 1st. And we all have to be engaged in the mission of enrolling as many people as possible, even amidst the new data sharing threats that we've all acknowledged and discussed are very real. But I'd rather have people on the rolls than not. And then once they're on the rolls, we have to work really hard to make sure through these new 6-month redeterminations that they stay on the rolls, that we get really creative about helping folks meet their work requirements, their so-called work requirements, whether that be working with community-based organizations to log community activity hours for our community members so that they could meet those paperwork requirements, whether that means that we work through automation solutions so that we don't have to rely on self-reporting, but that we can automate these requirements to keep as many people on the rolls. That's the work that we have to be engaged in and that we're planning right now. But the partnership between our community-based organizations and those of you here today has to be inextricable. The competition over general fund resources in the state legislature is going to be tremendous. So the fact that we can stay united without any daylight between us about the priorities is going to be key as well. But I'm confident, again, because of the success that we've seen as a community, community-based organizations and counties and state together, expanding coverage for people over the last 10 years, getting people to stay on the rolls as much as possible during COVID unwinding. I believe that we can overcome this moment as well. And to remind ourselves that it can be a moment. It doesn't have to be our permanent future.
Yeah, thank you so much, Carlos. I really appreciate the framing around, first of all, that this is a moment, that we are working towards something else, something better, right? And I think you're also touching on, and everyone has really touched on this at this point, but in terms of that information sharing piece, Alondra, I think you've spoken about the impacts on community members, but I'm also curious, Carlos, how is this data sharing, to ICE, how is it impacting counties? And I'm hearing you speak about trust. And for a long time, as you're saying, counties have been a trusted institution where you get your safety net resources. So could you speak to how this moment of data information sharing is impacting counties?
Yeah, well, I will say that when we learned through the Associated Press, like everyone else, that the Center for Medicaid shared voluntarily data files, Medicaid data files with the Department of Homeland Security and ICE, we immediately went to the state agency, DHCS, to ask hard questions about the veracity of that report. Because it also was a betrayal for our county workers and our county administrators who had been saying for decades that you can trust your data with us and that it would only be used for quality control and audit purposes. It is a federal statutory requirement to share data with the feds. That is a reality. And California has done its part in doing so. And the feds reneged on their side of the bargain. So I will say that we join everyone in the community in feeling betrayed. And what we've done as an association is we've instructed our directors after that point to have tailored conversations with Medi-Cal recipients and prospective enrollees about how to balance the risks for themselves and for their family. The reality is, because of the data sharing threats that we're facing right now with our Medicaid and Medi-Cal data, there is not a one-size-fits-all solution to this problem. It's going to take workers, and it has taken over the last several months, workers having individual conversations with recipients and prospective recipients saying, listen, if you are already enrolled in a public benefit program, or if you already have a tax ID, chances are your level of risk is already high. And so if you enroll in Medi-Cal, your risk isn't going to increase. And so on balance, if having coverage means having an emergency covered, God forbid you or your family is in a medical emergency, we can't give you any advice, but we can leave you with that balancing test and then allow people to make the decision for themselves. That's the best we can do at this point.
And can I jump in on that one? I think that's where, as we think about the providers on the ground, having those trusted community members that can be the go-between, the community that can have those conversations are really critical. As a priority, it should be a priority for funding. And that's going to be the challenge, right? When we look at the state budget, the healthcare navigators, the enrollment navigators, that funding is gone. And I know for our health centers, we're finding a way to prioritize to keep that as part of the healthcare delivery model. So, I think that's a good example of the way we have to think about this moment in time. I agree. That's a great way to frame it, Carlos, is what are the things that we can make sure we hold on to, even though we're challenged, that we prioritize them in our collective budget. And those enrollment navigators, the promotoras, are really key because they can have that trusted conversation, because ultimately people have to make their own choice for the safety of their own family. And so it's prioritizing things like, parts of the healthcare team, that model of care that's very different than a more traditional medicine. And then keeping an eye for some of the changes. They are changing. For instance, emergency medicine for undocumented immigrants is going to shift to fee-for-service. And as we roll that out, keep an eye on, like, how do we protect the data and the information? How do we do it in a way that people feel like they can still trust going to the ER and accessing care?
Absolutely.
Yeah.
And I wanted to add to the navigator conversation. We counties also, I think, are recognizing that there's a place when we should be stepping up and there's a place when we should be stepping back. And so in the case of trying to build navigators and CBOs into our systems of care, particularly the promotore and promotora model, which is wildly effective in the reproductive healthcare setting, we know, and every other setting that we've researched. When can counties actually contract with these organizations to do the trust building work necessary? I think we would love to partner with you and everyone on in the community to get those resources drawn down from the state.
Yeah, and I want to maybe shift us here to envisioning, right, what Medi-Cal can look like in this moment. But I also want to recognize that, Alondra, you're here. You've played that role as a promotora and very, overlapping with navigators. So how do you navigate that question when we know that information has been shared, but yet we know that communities still need access to healthcare?
Thank you, Mar. When the data intrusion happened, a lot of community members actually wanted to disenroll from Medi-Cal. We told them that, no matter if you disenroll, it's not gonna prevent them from accessing your information because they already had the information. As I mentioned before, for a lot of community members, having Medi-Cal is the only way to access their medications, to continue going to their appointments. A lot of people have diabetes or other health problems that they constantly need to go to the doctor. So they are saying, oh, if it means that I'm gonna have Medi-Cal, I'll continue with my Medi-Cal enrollment. But a lot of people were very concerned. They just wanted to disenroll but keep their families. A lot of for the kids, they're like, okay, I want my kids to be on Medi-Cal, but not me or my husband or my wife. So that was a really hard experience for a lot of community members. But as we're informing them, and as Francisco and Carlos already mentioned, now is the time to enroll as many community members as we can, as possible. And people are starting to ask, and we are seeing a raise. Like, a lot of people are coming into the office and actually just want to enroll in Medi-Cal, and they're also informing their family members. But yeah, thank you for that question, Mar.
Yeah, of course. So with that, I do want to shift us to, and I heard a little bit about this from everyone here that, we probably saw each other in the halls, at the Capitol, and we were trying to advocate and save the program, right? No cuts to health for all, keep Medi-Cal intact. But, we did the best that we could, but we still got the budget that we did at the end of the day. And so I think I want to turn us back to this moment that we're in, where we see Medi-Cal sort of eroding, and we're sort of looking for new opportunities or alternatives to some of these cuts. And this is for everyone here on the panel, but what are some solutions that you all are looking at? What are some alternatives to what we're seeing right now in terms of the Medi-Cal program? And I want to reemphasize that I heard, the North Star and the thing that we really want is full scope Medi-Cal for everyone. I don't want to lose that, but I know that, we're also in this specific moment where we may be looking at alternatives. This is open to anyone.
Who's going to go first? Go, Diana. I'll go after you.
Great, thanks, Francisco. I'll point folks back to that paper that I think is in the chat, that we need to look at the models that we had before we expanded care. Specifically, county indigent care models. There's still a requirement at the county level to be the provider of last resource. There's those still laws are still in the books. There's a lot of ways that counties, despite their financial budget situations as well, could support access programs. That's one area to look. There's state frameworks and models that we used in the past that could be built upon to create access in different ways. And there's going to be a lot of trade-offs. It's not going to be perfect. Nothing is going to meet all the needs that we and everything we have with Medi-Cal. So I just point folks to that and know that a lot of thinking is happening in the state right now about what these options are, so that we can provide sources of care for our community.
I think I agree with Diana and Mara. I agree. I think the North Star is full scope Medi-Cal, and the other North Star is back to what Alondra said at the beginning. The true measure should be actual access to care, not just coverage. To keep that in mind, and then the other question, as we think of, can we design something that allows us to get through this moment in time where people have the care that they need, and then you turn the knob back on full scope when we pass this moment in time. I don't know what that looks like. We're working with a bunch of really smart people with a lot of data to see if there's a way to land that in partnership with the California Healthcare Foundation. And then the other thing I think I would add to that that's really important is we're probably going to be asked beyond the undocumented immigrant population. How does that look like for even services like abortion, gender affirming care, right? Planned Parenthood was effectively defunded. And I know they're trying to solve for that. And then all the people that may lose coverage because of the loss of the subsidies. And so I think part of the challenge is going to be, how do we make sure that all Californians, that was the effort, right? Regardless of background or immigration status or the care that you need, how do we provide that access for them? We're gonna have to figure out that piece, and we got a year or less, but I think the goal should be full scope. That is the most efficient way to do it.
Any thoughts, Alondra or Carlos? If not, okay, I see you, Carlos, getting off mute.
I was just going to say I agree with the general sentiment that, full scope Medi-Cal is the most effective and efficient mechanism for coverage that we have. And as I shared with you, Mad, when we were preparing for the panel, I think we really struggle with this idea around standing up an entirely new or restoring an old and potentially no longer adequate system when we are implementing work requirements and new redetermination requirements in 2027, which is a year before the next presidential election. So it's just really hard to figure out whether, like, how you stand up an entirely new infrastructure and ultimately, if that's the right path forward, or if it's trying to get folks emergency coverage through some other mechanism in time for us to ultimately be able to repeal this thing from the roots if we're lucky enough to have a new government in 2028.
Yeah, I definitely hear you. How do we ensure equity in whatever we do, right? I think we know that Medi-Cal, although really important program, is not perfect. And if we do, prop something up completely new, how do we ensure that we don't make some of those same mistakes where we saw inequities, right, within the Medi-Cal program? So completely agree, very complex question. Sorry to put you all on the spot there, but I do want to get to at least one Q&A, question from the audience. And thank you all so much for engaging with this panel. A lot of great questions, but I do want to ask Nati Alvarez's question here. I think it's a really interesting one. Diana mentioned that there's still time for the HR1 changes to kick in or be stopped. Can any of you share some of the negative consequences that we should still expect to see if these changes are stopped, or if the Republicans and Democrats come to a more positive agreement? And for Francisco, how does that look for clinics, especially as most of or some are already preparing for the impacts of these cuts? So very interesting question.
I can start, and I feel like every day I'm like, this couldn't get worse, right? And then it does, and so maybe it's lack of imagination on some fronts, but I think it could have been worse in terms of HR1. There were things that got left out of HR1 that we could see come back. I'm not a federal policy expert. I can't speak to the likelihood of that, and it's something that we have to always keep our eye on. And I think my comment was rooted in the fact that the devil's in the details and how these policies get implemented and the guidance on these specific policies. I'll give you an example of like work requirements. Like really how CMS says these work requirements need to be implemented is really going to change how, if California gets more time or if there's more exemptions, right? And so I think that is the area that I think we'll find out more, and we'll know how, you know, it either could get worse or it could be better just based on the guidance of how this stuff is implemented. And I think the most immediate thing, you know, I think that we're talking at the federal level is these enhanced and premium tax credits, right? Like that could be addressed soon. I don't think it's going to address the immigrant piece, but we're hoping that that gets addressed with this federal shutdown. But I also just want to offer, you know, to your point, Mar, Medi-Cal is great and it hasn't always worked, right? Like there's problems with Medi-Cal. Let's just be real. Like it's not the ideal system. And there's an opportunity right now, and there has been, to re-envision what Medi-Cal could look like. And so I offer that in a hopeful note, because I think there's things that we can improve upon in the Medi-Cal system as we look towards the future. So
On the health center piece, I think the question is how does that impact health centers? The potential changes in HR1. You know, I would think about it this way in terms of a timeline. The immediate concern now is the impact of ICE on the community and their willingness to access care. That's been front and center. The elimination essentially of community health centers as part of healthcare for all in the proposal. You have some health centers that may have a small percentage of their total patient base where it'd be, you could even, you know, take them on without pay. For some health centers, you have some that have 20 to 40% of their patients are in that category. That's a hard shift to in terms of still being able to provide care and maintain your doors open. So it's really threatening. HR1, the work requirements, you know, to Diana's point, there's a lot of thinking about how can we help our patients submit those requirements. Is it a new tool? Is it working with the counties to make it really easy for folks to go through redetermination, to show volunteerism? Can we take what we learned, to Diana's point, like the work on CalAIM and social determinants of health? I think that's going to continue with money or no money. Because it's been some have really figured out how to do it and how to connect with each other. Can we learn from that on the volunteerism piece? Right? Folks are talking about that. Can we make it really easier for folks to meet their work requirements or volunteerism, and make it easier for your local pastor where you're volunteering to fill out that form? We don't know yet because those guidelines are still going to come out. I think that's Diana's point, that we got to stay on and make sure that's as easy as possible. And the health center role is, we're in the middle of it, a trusted source for the patients. And the one last note I would highlight is just the people at the health centers. We've looked at our own demographic data. Over 67% of our leaders, or it's our doctors or CEOs, are people of color. Actually, it's 70%, majority women led, right? There's people in the community. And that's really important in this moment in time where nonprofits, you know, we're all feeling it. We're really being threatened. But that's also an opportunity to step up and continue to show how resilient we're, that key piece to thrive during this moment.
Yeah, really great note to end on, Francisco. And we have come to the end of our panel. I just want to thank all of our panelists for being here today and having this really important conversation around, again, a program that is so important to our communities. I know that I will be seeing you all in the halls and continuing to advocate. And we just really want to thank you for all the work that you've done up to this point. Really appreciate all of you. I'll turn it back to Jocelyn.
Thank you, Mar, and thank you to our wonderful panelists. With over 50% of Medi-Cal recipients being Latino, the program and its policy shifts are going to have a major impact on our communities. And now it's time to move on to our last panel of the day. We've talked a lot about community needs today, including specific health access needs and health delivery. For our last panel, we are moving the conversation to our state's Latino workforce. In a state like California, what should a culturally competent workforce look like? A workforce that actually reflects our rich diversity, and how do we reach this goal? I want to welcome our moderator and panelists. This panel will be moderated by LCHC Board Chair Berenice Nunez Constant. Berenice, please begin whenever you are ready.
Hi, everyone. Good afternoon. Can you hear me okay? Hi, can everyone hear me okay? Okay, wonderful. Okay, well, it is my pleasure to be here with you all this afternoon. As you heard, my name is Berenice Nunez Constant. I'm the Senior Vice President of Government Relations and Civic Engagement at Ultimate Health Services. We are the nation's largest federally qualified health center, and so much more. I know a lot of our friends and partners are here with us today, so it's been so nice to see you all on different conversations. We also, I'm sorry about that, I did not know my video was off. As you heard, I also have the honor as serving on the board for the Latino Coalition for a Healthy California, and then moderating our last panel of the day. I don't know if that is a compliment or I'm here to just kind of bring a little bit more energy. So I will do my best. And our conversation today will be on the future of Latinos and our healthcare workforce. As you all just heard, I'm joined by some amazing amigos, amigas, gente today, and healthcare leaders in the world that I live in. One of my super amigas and femtors, Marta Santana Chin, the CEO of LA Care Health Plan, Angela Minifield, Senior Vice President, Advancement and Operations and Chief Operating Officer for Charles Drew University of Medicine and Science. We also have Maria Lemos, who is the Executive Director of Visión y Compromiso, Alfredo Lopez Aguirre, who will bring the important medical student voice. He's a medical student at UC Davis School of Medicine, and Elia Gallardo, who's the Chief Equity Officer and Deputy Director for the Department of Healthcare Access and Information, or HCI, as we kindly refer to it as. But before we go into our questions with our panelists, I really want to take a moment to start to ground us in the themes that we have heard throughout the day. Today, we learned so much amazing information. We learned about the Latino GDP that has helped to propel California to the fourth largest economy in the world. And so it is in our economic benefit to provide world-class care and healthcare access to Latinos. We discussed community resiliency and solutions to support our immigrant communities. We tackled the Medi-Cal moment we are facing and the challenges and opportunities to rethink our health systems to best center our community. And my apologies, I'm hearing that my camera is off. Can you all see me okay? Yeah, okay, I will continue then. Okay, perfect, thank you. I also want to ground us in how important access to healthcare is, especially when we are facing barriers to access to access it for so many across our sectors. But I want to shift our thinking to the people and systems that are behind ensuring access to this care and its delivery. And this is our healthcare workforce. Latinos make up 40% of California's healthcare workforce. It's a fact that we keep this economy running. Yet a struggle continues to exist. A struggle continues to exist to ensure that the needs and contributions of Latinos are adequately represented in California's workforce. So let's take a quick snapshot of our community. In terms of Medi-Cal, Latinos represent over half of Medi-Cal recipients in our state. Older Latino adults make up 8% of California's Latino population, and by 2040, Latinos will make up close to 24% of California's older adult population. Our growing population also means a growing need for aging and specialty care. This is especially true in hard-to-reach areas and by those who rely on Medi-Cal for their coverage. And finally, we all know, likely through our own real-life lived experiences, that a healthcare workforce that reflects us, that reflects the communities that we serve, not only is beneficial to cultural competency and culturally appropriate care, but also improves overall healthcare outcomes. And so with that context, let's dive into the conversation today. So I am going to start by talking about representation in the workforce and reminding us that, we all know that representation matters. I want to open with you, Marta. Now that you are a whole 10 months in to the job, I have to continue to personally congratulate you on your appointment as the CEO of LA Care. Your appointment was historic, as you are also the first woman and the first Latina to lead the organization. So can we get a round of applause for that? I will give you an applause and continue to give you an applause for that. LA Care is the largest public health plan, not only in Los Angeles County, but in the country, serving 2.6 million members, many of which are Latinos. This represents more than 1 of every 4 Angelinos. I also just want to take another moment to acknowledge what a powerful and important role you hold and the immense scope of care you are overseeing to ensure the health and wellness of our communities. Muchas gracias for that. So Marta, I want to start our conversation by asking you to talk about your journey to becoming the healthcare leader and poderosa and CEO that you are. Did you see this possibility for yourself as you were growing up as a niña? And how has your professional experience and lived experience prepared you for this moment to lead?
So, Beth, first of all, thank you so much for the warm introduction and for moderating and for having me here today. I'll just start off by saying I'd like to just express my, really profound gratitude and honor for being able to lead and serve at this very pivotal moment and for the industry, but also for our communities. It's a privilege that I don't take lightly, and I carry with me a very deep and unwavering sense of responsibility to do the right thing for the people that we serve and also to represent with integrity and with purpose. And so I work hard at that every day. And, it's people like you and many others on the line and here on the screen with me that give me the courage to do that. So thank you all for your support. Now, if you had told me decades ago when I was a little niña, my nickname was Gorda, that I'd be CEO of LA Care Health Plan one day, I'd say, thank you and smile very politely, but quietly wonder what a CEO even did is really, what was in my world of possibilities back then. Many of you know, I grew up in poverty. My first job was translating for my immigrant mother, who had the tenacity to persevere regardless of what came her way. She had a second-grade education and taught me everything that I needed to know about courage, hard work, caring for others, resilience like nobody's business. She had it in spades, and she instilled it in me and always encouraged me to pursue my education. She also taught me a very powerful skill, and that is the ability to negotiate. Her philosophy was you can negotiate anything, especially if you listen and you act with conviction and you do it with integrity. Negotiation is always an open door, is always a possibility. Now, as I was growing up, my family relied on Medi-Cal, and so I know what it is to navigate the systems that weren't necessarily built for our families and for our communities. I didn't have a privilege of having a roadmap through life, but I had grit and purpose and a village that believed in me like nobody's business, sometimes more than I believed in myself, and I think we all need that. And so if you have the opportunity to make sure that, you know, those around us believe in themselves, do it. It makes a difference. You know, I still remember the fire, and this was, our condo was destroyed in just a month before I had to commit to transfer to a four-year university. And I was ready to just say, I'm going to stay home and help mom and my 8 siblings, make sure that they are able to survive and be fed and find a home. But my boss at the time, her name was Deborah Cox, when I worked for a public health clinic, actually, privatized public health clinic, Latino Family Medical Group in Oxnard, California, South Oxnard. She gifted us the equivalent of $12,000 in today's dollars. And she gifted it to us on the condition that I continue my education. And that changed everything. Had it not been for her, I may not be here today. And my aunt made space for me in her already very, very full house in Long Beach, California, rent-free, so I could pursue a higher education. Then a friend connected me with a temp job, typing up a business plan for a firm that eventually became Tenet Healthcare's managed care arm. And that job opened so many doors I didn't even know existed. Later, another boss offered to pay for grad school for me in exchange for many years of service. And that investment wasn't just in my education, it was really in, you know, my ability to lead, my voice, my future, my power. And through all of that, my husband has been my rock. You know, I went back to grad school when our boys were 5, 7, and 9. And this was back when, I think Diaries of a Wimpy Kid is still very popular, but the mom, Susan Heffley, Greg's mom in that series, in one of the books, decided to go back to grad school to avoid all the kids. And so I had to convince my kids that I wasn't really doing it for that. I was doing it for them and for their future. And eventually they believed me. But, you know, throughout my career, just leaders have trusted me to solve very tough problems and rally teams around a common cause. And for that, I am eternally grateful. I've had so many opportunities, and that's really what has allowed me to be here today. I had a chance to build teams, to launch programs, to turn around failing businesses, and do it all with purpose. And they all believed in me, and they believed I'd rise to the challenge. And you know what? I delivered, and I'm proud of that. But I'd also be lying if I said that I felt like I belonged that entire time. You know, I'm a woman, I'm Latina, I'm like all but 5 feet tall with the right pair of shoes, not every day, but with the right pair of shoes. And, you know, for a long time, those things really made me feel like I was an outsider, like I was an exception, like I was an imposter. But eventually I came to realize that those are really my superpowers. I became that triple threat, that person who had an exceptional work ethic and showed up every time prepared and wasn't afraid to bring my lived experience that connects me so deeply with the work that we do and with our communities with me every day and in every role that I've served. So, you know, today I don't just stand here as a CEO, I stand as proof that people like me, that people like us in our community can thrive, can lead, can transform systems from the inside out. But here's the truth. You know, all of that good fortune I've had throughout my life and the luck and the kindness of a few people that got me here didn't necessarily have to be that way. You know, people like me, women, you know, people of color, people coming from low income communities, first generation college students, We all deserve the same systems of support that have helped so many others succeed. We deserve to be seen, we deserve to be invested in, we deserve to be ready and not just resilient. And so my challenge to all of us is this: let's build a world where, yes, we lift each other up and look out for one another, much like you're all doing for me and for each other, but also where stories like mine aren't an exception. They really become the expectation. And so that's my challenge for us all here today.
Love that. Love that. And your story, you know, just reminds me, right, of the trajectory. I think that's why I've connected with you since the beginning, because, you know, we have found our way, but we've had all the wind beneath the wings along the way. And honestly, it is a fight every single day to bring that lived experience forward, because sometimes it doesn't feel as if, you know, it's supposed to be part of the conversation, or at least earlier on in my career, it felt like it wasn't supposed to be part of the conversation or what I was supposed to be bringing forward. But like you, I have really discovered that this background is really part of our superpowers. And now I say that with an S. And I'm so happy, you know, that I have the ability to continue to learn and walk with leaders like you, Marta. So stay tuned. We will come back. I'm gonna move us over to Elia. Elia, hola, good to see you, amiga. Nice to be in company here with you and in community. I want to move us to you to zoom us out a little bit and have you talk to us about the healthcare workforce from the state perspective in the position that you hold at HCI. So here is the $1 million question, and probably appropriate to say it that way because of HCI and how you are holding a lot of the funds as it relates to workforce at HCI. So why does Latino representation in government and our healthcare infrastructure systems and in our healthcare infrastructure systems matter in California? I'm going to go ahead and just put it out there already as you think about your answer. What does it look like to be Latina from your perspective, also in the state workforce and in leading the work that you do? Elia?
Thank you for the question. And I'm going to actually begin by repeating something that you said on why this matters. Latina representation in our healthcare delivery system matters because health outcomes matter. If you look at the mountains of research on diverse and representative workforces, what you see is that patients' access to care improves, their perception of care improves, and ultimately health outcomes improve. When you have a provider that mirrors your characteristics, your personal characteristics, as you can imagine, that fosters relationships that are built on respect, empathy, and trust. It's pretty obvious to know that when you speak the language of the patient population that you're serving, research also shows that you're going to be able to get that greater sense of trust. You're going to see increased accuracy with your diagnoses, and it's going to lead, again, to better health outcomes. So representation matters because you mentioned 40% of the California population is Latina. And if you want those better health outcomes, representation matters. To talk a little bit about the second part of your question, as HCI's Chief Equity Officer and as a Latina in that position, I get to bring my entire experience and my background to the work that I do. So I don't just show up as me, myself. I show up with my history and experience, my parents, their farm worker background, my monolingual Spanish-speaking home, my grandparents who, you know, grew up in Mexico, moved into the United States and had that first generation experience, my history of being the interpreter for my parents in medical appointments at a very early age before some of the laws that really provided us with some of those medical interpretation services came about. So I get to bring that experience to the work at HCI and the work that we do with our healthcare workforce, and really get to lift up the importance of both diversity and language concordance within both our work internally as well as our work externally. We annually take a look at our own workforce and we compare our own workforce to that of our state, our whole state workforce, to that of the California labor force and then to California's population wide, so that we can see how we're doing, where our gaps are, where our disparities exist. And then I also get to support our workforce staff in thinking about how to promote and advance diversity in the health professions in those multi-million-dollar programs that we have, and also to think about how to advance our goal of diversifying California's workforce, despite the changes that happened in 1996, where we are not allowed in California to give preferential benefits or treatment to any race or ethnic group on the basis of regardless of whether they're underrepresented in the health professions, because of Proposition 209, which has been in existence since 1996. So we really I get to support them in thinking about what can we do to promote a diverse workforce, and we really focus on creating equity and equality within the playing field or the landscape that we work in. So in our scholarships and our loan repayment programs, where we're looking for that healthcare profession that can meet the needs of the communities that we serve, we'll be trying to eliminate barriers that most students will face if they're underrepresented. Things like giving extra points if you come from a low-income background. Giving extra points to folks for loan repayment and scholarships if you're first generation in coming into colleges. We look at these kinds of what we consider to be race neutral, because they are, but they also try to get at the barriers that prevent underrepresented communities from coming into the health professions. We'll look at whether you graduated from a high school or received your GED in a shortage designation area, because those are if you worked in a shortage or lived and grew up in a shortage designation area, you're likely to go back to that area, or more likely to go back to that area. We want to look at experience with populations that are underserved. We want to look at whether you participated in cultural competency training while you were in your professional training. For the institutions that we fund, we want to make sure that they're lifting up curriculum that advances cultural competency in their training curriculum. We want to make sure that they're doing outreach to underrepresented students, to make sure that they're trying to let them know about the opportunities of becoming a health professional. And we want to see if their selection committees for their student body, if they have diverse panels that look at students in order to mitigate implicit bias within the selection process. So we do what we can within the confines of the limitations that we have because of Proposition 209 to try to address and create a more level playing field for everybody to compete, and to also lift up those barriers or eliminate those barriers that underrepresented communities face.
Wonderful. Elia, I have to, while I have this time with you, I have to ask you one additional quick question. We are all watching, and waiting for those federal changes to hit us, right? In terms of the policy changes that are happening. And I want to ask you, how is this going to impact your current work? And how are we anticipating that it's going to impact the future workforce pipeline within our state's infrastructure?
So some of those impacts we're already starting to see those impacts. And to be honest, it is a combination of many things that have happened over the last few years. A recent court case decision around Harvard University and some of the programs that they had on their admissions, as well as the federal administration's executive order, where they're looking at reinterpreting diversity, equity, and inclusion in a way that's really not supportive of promoting diverse student bodies. So the federal administration is attacking what they call illegal discrimination, but conflating that to really equal diversity, equity, inclusion. Lots of very good legal programs that have been promoting equity throughout a long history in California. So even though, because I mentioned in California, since 1996, we haven't been able to give preferential treatment anyway, these laws really don't have an effect really on California, our public entities, our public education, because we've actually been implementing that same provision since 1996. But what you do see is the universities feeling chilled and walking back from some of the programming that they've had in place that's completely legal, but because they're worried about the investigations and the pressure that the federal administration is putting on universities, many of them are not even coming into the fight. They're just giving up to begin. Some of them are doing what I'm going to call finesse. Some of them are doing the exact same work that they've always done. They're calling it something different. And that's their finesse. So clearly, if finessing is what you need to do so that you can keep that good work alive, then more power to you. It's what we're concerned about is those that are really stepping back from the work. And you've already seen some reductions in representation from cases like the Harvard case and from the executive order and the pressure that the federal administration is putting on academic institutions. You're already seeing drops in diversity nationwide. So we are very concerned about what the pipeline is going to look like as a result of some of that chilling activity that's happening on the federal level.
Thank you, Elia. More of that, unfortunately, more of that fear pandemic that we find ourselves in. Maria, I'm going to invite you into the conversation now. Another partner and amiga, thinking about another healthcare career path. And that is a career path that you have dedicated yourself to as a promotora and through promotores and their powerful role on the front lines of our public health systems. Maria, as the executive director of Visión y Compromiso, an organization that is committed to the community's well-being and by supporting promotoras and community health workers, please share a bit about the history and the role of community promotoras, and why are they such an important part of the healthcare delivery system, especially in this moment?
Well, thank you for inviting me to be on the panel. It's a pleasure. I want everyone to think about their family and to think about their mother or their tia or their abuelita, somebody who's always giving in the community, taking food, giving rides, taking care of somebody when they're sick, looking after. That's a promotora. I grew up with that family. My mother was a promotora. My abuelita was a curandera. I grew up in an environment that supported of mutual support. We now call them promotoras. But in those days, it was your tia, it was your abuelita, it was somebody in the neighborhood. And that person exists in every community, every racial, ethnic community. It's not just a Latino thing, it is a human thing. And so I grew up that way. And in 1999, we coordinated a conference for HIV and Latinos, and about 300, at that point, they were called, I forgot, HIV term. And they came together and we started to talk to each other, and we realized we were doing the same thing across the Southwest. We started meeting and talking, and that's really when the term promotora was lifted up. And we found that we were all working while in different states and different communities. We were providing the same services. Most of it was free, and most of the promotoras were not paid. They were volunteers who were associated with clinics or with CBOs, with community-based organizations. Fast forward 25 years now. Visión just celebrated 25 years at our annual conference with 1,000 promotoras celebrating.
Felicidades, felicidades.
It was an accomplishment, I must tell you. And if you fast forward, we now have lifted up the role of the promotora. We now have acknowledged and said this is a very important role, not just for education, information, navigation, but for advocacy. They are the voice of the community. They bring forward what the needs are. And if you remember during COVID, we were called the essential workers because we were going places where nobody else could go. Well, we get a lot of credit for that, but yet there's no funding that goes to the promotor model. And the promotor model is typically associated with community-based organizations, and they're the ones that are least resourced. So when they ask us through our advocacy, through our network, they say, Maria, the things that we want as part of the network of promotoras y trabajadores comunitarios is we want recognition, we want leadership, we want advocacy, and we want to get paid. And so the pay issue is, you'd think it'd be easy, but it took us almost 20 years to get to recognize the role of the promotor, of the promotora. And we say la red de promotoras because the majority of promotores are promotoras. And so we say specifically it's a woman's issue. And these women are day-to-day out there. And in the past, they were getting gift cards or they were getting $25 or for a day's work in the sun, in the fields, in the neighborhoods when nobody else would go. So we have lifted up that profile and said, yes, we're important. And accordingly, we want salary, benefits, and retirement. Visión y Compromiso, we hire mostly promotoras, and we provide a living wage with benefits and retirement. And that's an example of what every CBO should do. We do understand CBOs don't have the funding for it. I mean, it costs money to provide those. So on the other side, we advocate. We have a coalition called La Alianza of CBOs that partner with the network advocacy efforts to really advise and inform that if you want this promotora to really be, if you value the promotora and the work that they do, then how do we pay them? And how do we pay the organization for the back end so they can support them? And that's what we're advocating, lifting up the promotor model. We also see it as a workforce issue for their children, because when the youth see, and we're training youth promotores right now, when you see that their mother has a job, has benefits, and has the respect, then they're telling us, well, maybe I can be a promotor when I grow up, because not everybody's going to go to college, right? You just look at our dropout rates. Not everybody's going to go to college, and not everybody's going to be a physician, not everybody's going to do all these wonderful jobs or work for the state. So we have to look at other workforce options. So when we talk about workforce for us, it is really integrating the promotor model. And we say that a promotor has a space from preconception to death. If you look at all the services that we can provide in the health system, in the health continuum, we can develop a role for a promotora. And that's what we ask in our advocacy, is really for institutions to look at how do you integrate the promotora in, we have programs for early childhood, for the informal caregiver, all the way to a death and dying program.
And Maria, let me ask you, because I think that the value of this, we all recognize what a powerful role, right? The value that this brings, right? But to your point of making sure that it's being supported and financially supported, I know that HCI and HHS has also been working to center the work of promotores. So can you talk a little bit, and I'll invite Elia in for a little bit on this one as well, but Maria, can you talk to us a little bit about what these partnerships look like between the state and promotores, and what are some of those challenges and opportunities that we are seeing?
Well, we were part of the initial discussion with the Community Health Worker Funds that DHCS initiated maybe 3-4 years ago. And they spent 2 years really defining the role and the curricula and what's necessary to incorporate a community health worker and a promotor and a representative. And then it moved over to HCI, and the funds have dwindled tremendously. I think it went from 188 million to 12 million. And so we're really talking about a very small pot that they're trying to figure out right now how to disperse that across the state. I think if they were really valued in the community, not only in the Latino community, but across others, then I think there has to be more. I mean, we would advocate that HCI get more funds to be able to distribute to communities. But I think there are some initial barriers, and there were some initial barriers in terms of understanding the role and the community role and the institutional role that's with clinics and agencies, and then the community role and what are those requirements. We do talk about unintended consequences. So if you want my mother to work for you and she had a 6th grade education and didn't speak English to the day she died, and you ask for a high school degree and English speaking, you're not going to get my mother. You will probably get, at least historically, you would get a Spanish speaking non-Latina, which defeats the purpose of lifting up our community, our experts. So It took a while to understand those logistics and that regular administrative requirements didn't work for this community and still don't work for this community. And all we ask the state and HCI and everyone to do is look to the experts in the field, look to other CBOs like ours who've been us for 20, 25, 30 years to see how we can massage the system. And
on that note, Elia, can you talk to us a little bit about, just give us a minute or so on kind of where the HCI role has been, and any thoughts on what Maria just shared?
Maria is one of our premier advisors around the work that we do. So we definitely need those voices in the mix. And she's absolutely right. All of us are looking to community health workers in their critical role as trusted liaisons. And I was just going to quickly lift up just another additional collaboration. And this one also is with the Department of Social Services, our California Department of Social Services, where they are creating hubs to support the immigrant community in this time of need. When anti-immigrant rhetoric increases, you see huge increases in serious psychological distress among immigrant communities, in particular new immigrant communities. They're going to be providing legal services to immigrants to support them in this current climate. And they recognize that people are just not going to come to them. They're not going to, the fear out there and the concern with interacting with government entities is at a height. So they're not going to come to them. So we're all working on how promotoras can be that trusted liaison that supports these individuals to not only access the DSS services, but also to be looking at the other needs that they've done traditionally and supporting them to get the healthcare needs met and their behavioral healthcare needs met, because they're the ones that know where the linkages are, and they're the ones that can support the community to access those services as trusted community liaisons. So I think that the secret is out. The promotoras are a critical workforce if we're looking at increasing the healthcare, the health outcomes for that population. That secret is out, and Maria has been a strong leader in making sure that secret is, that it's not a secret, that it's pretty much, very loud and clear, the critical need.
Yeah, thank you both. I'm coming to you, Angela. I'm so excited to have you here, especially because we have a strong partnership at Ultimate Health Services with Charles Drew around our provider residency programs. And so it really makes a difference, the curriculum, but also your vision at the organization at CDU to really kind of focus on this kind of cultural anchor in your residency curriculum. And so I'm so proud that together we're really working to train the next generation of providers that are serving the communities that we're talking about today. And so we've talked about the different pathways that exist, but for many, the workforce opportunities that they're looking at is there's aspiration about becoming a doctor, right? Like somebody asks you when you're little, what do you want to do? I want to be a doctor. I want to be a lawyer. And so, so at Charles Drew and its medical school, can you talk about what the vision was for this different type of system and service and retention model for your students?
Sure, Berenice, thank you. Thank you, LCHC, for hosting this panel. I'm honored to be on the panel with so many distinguished friends. Berenice, specifically about your question regarding the university. The university is a private nonprofit university. It is community founded in 1966 out of the Watts riots. And it was really the community who called for the birth of CDU. A group of women, the late supervisor Kenneth Hahn, others in the community that realized that this area of South Los Angeles was really deplete with education opportunities, specifically higher education opportunities and accessible healthcare. And so during the 1965 Watts riots, CDU evolved, and it was actually founded in 1966, along with the MLK Community Hospital. I give that context because CDU was born out of the civil rights moment. And CDU is living proof of the difference that an institution that is focused and founded by community can make in California and particularly in South Los Angeles. So you asked about our vision. Our vision is a world without health disparities. Our mission is really about cultivating diverse health professional leaders who are dedicated to social justice and health equity for underserved populations. And the way that we do that is through our education programs, through our research on health disparities, through clinical service, and again, on community engagement. We, when we opened our 4-year independent medical degree program in 2023, we became the first medical school, medical degree program at a historically Black college since 1981. I also want to point out, however, that CDU also carries the designation as a Hispanic serving institution, as we are a member of HACU. We did this with obviously the dream of our founders, because it was the community's dream that a medical school be born, delivering academic program in South Los Angeles. And then we were able to build a pipeline, as you all may be aware, through our joint program with UCLA that began in 1981. But in or about 2020, when the California Future Healthcare Workforce Commission came together, they had a recommendation that was specific to CDU. It was recommendation 2.5. And that recommendation also validated and confirmed that what CDU was doing in terms of graduating Black and Brown healthcare providers in an array of professions was an investment that needed to be made to create a medical school. So here we are. We admitted our first class of 60 in 2023. We will have 240 students when we graduate our first class in 2027. And we are a community-based medical school. Our admissions process is one that is focused on a holistic review. Folks on the panel have talked about their lived experience. We value that at CDU. We value social justice. We value community service. So when we are seeking applicants to CDU, those are the things that we take into consideration. We look at the individual, not just their GPA, not just their MCAT scores, but we want individuals like Martha, like myself, who have come from lower socioeconomic backgrounds and have and know that we can make a difference, know that they can become leaders. It's those students who aren't often given that second look. And at CDU, we say that we are a home that is built for you. You're not just a guest, but this is your house. And in that, when we're building and thinking about the university's curriculum, it is one that is centered and built around those values of health equity, social justice, community engagement, not just as electives, but as core requirements. They are integrated throughout the experience of the throughout the student experience of our medical students. They also have early and sustained clinical exposure in the community. Our students are getting clinical experience in FQHCs. As you said, we're a partner with Altamed. They're also getting experiences in hospitals. LA Care, I should say, has been a major provider and source of support for our students through their Elevating the Safety Net with scholarships, because not only are we trying to attract the best and brightest Students that have those lived experiences, we recognize that financial assistance is often a barrier to medical education. And so partners like LA Care and Sutter Health and Bloomberg Philanthropies are really helping us to meet some of those students' financial needs. So that's a little bit about the medical school. That's a little bit about the curriculum. Hope you have a sense of why we do things the way that we do at CDU, because again, as a community founded institution, it is important for us to reflect and represent the community at all levels in our leadership, in our student body, of course, but in our leadership. And I say that purposely and deliberately. That goes from our board to our executive leadership of the university to the staff. Because again, this is a house that is built for students of color, students who may not be given a second look at other places, and students that we definitely want and our community needs.
Beautiful. Thank you, Angela. You know, we also say when, you know, we want to convey that sense of home, estás en tu casa, you are in your home. And so I love that. That's so important as these students find their way through medical school in a new space and place that is not necessarily a system that is not necessarily made for them or supportive of all of the lived experiences you just talked about. And so to that end, I'm going to invite Alfredo into the conversation. The important student voice. I know you are a year 2 medical student at UC Davis, and you are really, so felicidades on that. That in itself is such an accomplishment. And you're also a proud first-gen immigrant who's committed to serving and providing care to our Latino communities. This is clear through your leadership within the Clínica Tepatí at UC Davis and the REACH program as well. And so want to ask you a little bit about your trajectory and your workforce journey and what drew you to UC Davis Medical School.
Absolutely. Well, first of all, thank you so much, Berenice. Thank you, LCHC, for inviting me. And let me just say, like, it's truly an honor and a privilege to be among like some very powerful Latinas. I've always said this, but I stand on the shoulders of giants, and it's just a pleasure to be among those giants and sharing that space with you all today. To tell you a little bit about myself, I am a descendant of a long line of very hardworking farm workers. I grew up in Michoacan, Mexico, before immigrating to the United States. As a teenager, my family and I have moved all around the Central Valley of California, following the crops. My mom was and continues to be a farm worker, so we would follow the seasons all around, all the way from Bakersfield, Fresno, Madera, up until we ended up in San Joaquin County, where my family still lives, down in Manteca, California, about an hour south from here. And I very much say, like, I grew up in the fields. Back home, my grandfather was a strawberry farmer. And then here, you know, I would spend some of my summers before undergrad or college out in the fields, earning money to save for college applications. And, you know, during this time is where I saw a lot of the injustices that not just my family faced, but a lot of the people that look like us facing the community. One, coming to the United States and having to, one, learn the country, and then two, navigating the country as newly arrived immigrants. I think for me, being the oldest in my family, felt a lot of responsibilities of trying to really, you know, advocate for my family within these new spaces. And as many like the folks on the panel as well as mentioned, you know, having to translate in medical appointments at school appointments as well, was something that at the time I was just like, why do I have to do this? I found it being the norm, you know, like I saw everybody around me, all the families around me, or kids that came from a similar background as me, sharing the similar stories of struggle. And it wasn't until like I left to UC Davis that I started recognizing that these things are not the norm outside of my community, and really started to name these injustices, and putting names and understanding the historical context and all these structural barriers that allowed these things to present in the first place. And all of this, understanding kind of brought me on to Clinica Tepati very early on as an undergraduate. To tell you a little bit about this clinic, Clinica Tepati is a student-run clinic affiliated with UC Davis. It's also like CDU, it was born out of the civil rights movement to provide free primary care to the predominantly uninsured Latinx population in the greater Sacramento area. And now 50 years later, it continues to have that same mission. This is, a place where, one, I saw that being a physician was possible. I saw medical students who looked like me, who came from a background like I did, seeing patients who I still see as my family members. They look like my tios, my abuelitos, and I have that same care for them that I have for my family. But I also realized, that medicine is a form of advocacy, advocating for your patients, learning the needs, not just what they're presenting with in front of you or the illness they're having, but also the structural inequities that arise from there. And as a physician, there's a lot of opportunity to be able to make those changes to not just help them in their health immediately, but also help them in a more wide way. And then finally, I also learned the type of physician that I wanted to become, one who provides culturally humble care to a community who has often fallen through the cracks of the system. And I graduated during the pandemic. I was a COVID grad. I didn't really know what I was going to do. To be quite frankly, I literally graduated the quarter that the pandemic started. So I moved back home and I was working various jobs before starting to work with a project called the Orale Project, which essentially consisted of providing free COVID testing to Fresno, Madera, and Stanislaus counties. And the project primarily focused on providing these services to farm working communities. So at the time I was leading the project that worked with community-based organizations, with promotoras, which is awesome to hear, the back end with Maria's story of her work with them, because, like the ladies that, they were like really the on the ground community workers that allowed us to come into the community and start to be welcomed and build that trust with the community. And essentially, what this project consisted of, we were working out of white vans. We would go out to the fields. We would go out to canneries. We would go out to migrant centers and meet the community where they were at. We had late hours when the community was not working. We would work out on weekends at swap meets and really try to have that public health background of meeting the community where they're at. And then for me, I was seeing firsthand what we know now, that the Latina community were some of the most affected by the pandemic. All of these social determinants of health that we talk about, I saw them firsthand on the ground every single day, learning about the patient stories that we would see, all of these things that they were going on. And to me, it was just so frustrating that all of these things, were continuing to occur. It wasn't just the theory of what I learned in school, but it was full on in practice, the everyday experience that I was hearing. And for me, that was one of the biggest things that motivated me to go back into medicine, go back into school. I went back, did my master's in public health here at UC Davis, and then continued on to now obtain my MD also from UC Davis. So triple ag, very proud triple Aggie. And part of the reason what drew me back to UC Davis was, very similar to Charles Drew, the mission of serving California, serving underserved communities, and trying to create a workforce that reflects what California looks like. UC Davis is the most diverse schools outside of not being a historically Black college and university. And for me, that was very important. I wanted peers who came from diverse backgrounds who reflected California, because those, I'm going to be treating patients from all backgrounds and all walks of life. So that was, a very big priority for me. And the other part of it as well was being admitted into the REACH program. REACH is a pathway program, prime pathway program under the umbrella of the Community Health Scholars at UC Davis that specifically is meant to train people who want to return, who are from the Central Valley and want to return to the Central Valley and serve the community who are there, and give us the tools in order to be able to handle all of the things that are happening and all of the things and problems that are happening down in the Valley to best serve our patients.
Beautiful, beautiful. I think, leave us with a little bit of advice, Alfredo, on those that are aspiring here, right, to be physicians. What is one piece of advice that you want to leave with them based on your journey so far, as we kind of enter our last 8 or 10 minutes of this panel? Go ahead.
Absolutely. So I think for me, or advice that I would give is that your road to medical school or higher education or whatever you want to do doesn't have to be linear. My path looked like a maze. Like it was, went to one way, went the other, and really had to do a lot of trial and error before figuring out what worked for me. It was leaning a lot on my mentors, my community, in order to figure out how to get to where I'm at. It was mentioned earlier that it really takes a village. It takes a village everywhere. And for me, my village brought me here. So lean on your village. Your path is not going to be linear. But échale ganas, ponte las pilas, and that grit that that our community has every single day. Take that as your hidden advantages. I know Marta talked about, we often have all of these things that are superpowers, and we're often the underdogs that nobody sees us coming. Use that as also a superpower, because the Latino community is going to be a force, and is a force that is moving this country, and we will continue to do that.
Beautiful, beautiful. And since you are part of the next generation of physicians, I am all the way filled with hope for the next generation. Thank you so much. So Marta, I'm coming back to you, as we all, are filled with hope here. I can see the faces and the smiles. I know, going back to your experience as a leader in our health workforce space, I want to ask you about some of the creative solutions that folks have been working on to grow the Latino physician pipeline and its workforce. I hear you have some exciting news to share with us.
Yeah, I absolutely I do. But first I've just got to say, Alfredo, you're an inspiration. You make us proud, and we're proud of you. Thank you for sharing your powerful stories, and porque te pusiste las pilas.
Love that.
Y sigue las pilas necesitamos. You're exactly the kind of leader that we need to, help shape California's future. And Beta, there is a lot going on around us, but there's also some really awesome work and momentum that we're building. You heard Alfredo's story, and he went for it, figured it out, was scrappy, and found his way. You heard a little bit from Angela about some of the awesome work that CDU is doing. I would say UC Davis is also doing some pretty phenomenal work. And, one thing that was mentioned earlier that I just want to reinforce is it does take a village, and LA Care recognizes that it's an important part of the village. And that's why we have that Elevating the Safety Net initiative. I know Ultimate, CDU, several other organizations have benefited from the fact that we're able to support both training, recruitment, retention of diverse and highly qualified physicians to really help serve our community. So we're super proud of that. In fact, a few weeks ago, we just celebrated the 8th cohort of individuals that were sponsored for full ride medical school scholarships at CDU and UCLA. And man, when you look at these young people, the world is bright. I mean, they're there to change the world. I mean, I got to tell you, I felt like a slacker listening to some of these folks talk about what they had done and what they were going to do. So, again, our future is bright. And I am thrilled to share that just 2 weeks ago, you may have seen this on the LCHC social media channels, but the Latino Coalition for a Healthy California and its partners launched a More Doctors for California campaign. And we all need to get in on this action. We all need to be able to support it. This is really the next phase of work that I co-founded while I was at HealthNet. alongside my dear friend and longtime champion, Dr. Hector Flores. And, you know, this effort really began with a simple conversation between Dr. Flores and I. And we agreed that we weren't going to just sit there and admire a problem, that we were going to organize. We're going to figure out how to organize and, you know, bring things together. And so what ended up happening is that Dr. Flores brought a remarkable group of leaders to the table who, quite frankly, they dedicated their careers, decades of experience in the room, to addressing this very issue, underrepresentation of our communities, specifically in the medical field. And with the generous support from HealthNet, because I was working for HealthNet at the time, I convinced them to spend a little, and then they upped me one and contributed so much more. And through that investment, I led a strategic planning process that really helped shape a very focused, actionable roadmap that's grounded on the decades of experiences from all of these leaders. And it's very discrete initiatives that include solutions that have already proven to work. You know, I think I started to mention one of them today, the Pathway Program, and so many others. And so all of those colleagues in HealthNet were all in developing this roadmap, and now here we are, handing it off to LCHC because they're going to take it to the next level. And I got to just say, you know, the folks that were around the table were just so generous and passionate with their contributions and about their contributions. You know, they're all in for making sure that we're improving healthcare, addressing many of the things that you heard throughout the day today. And this roadmap has traction. You know, we've shared the intentions behind this with a number of funders, and they get very excited because it's organized, it's, you know, proven tactics, and it's about getting at the root causes and systems. And so between philanthropy and, you know, down the line, what we might be able to do by way of policy, it's really going to address the problem. And why does it matter? What is the problem? Well, now, we have 11 million Californians that live in areas without enough doctors to serve them. And we all know the demographics of California. You know, California, 40% of the residents here are Latino, but only 6.7% of the physicians that are serving our residents are Latino. And, you know, earlier you heard others talk a little bit about the importance of making sure that we offer culturally sensitive, medical concordant, or ethnically concordant care so that we could relate to the people that we're serving. And so, you know, we've got to address this. That gap, the 40% versus the 6.7%, is a crisis. And, you know, by the way, if we don't learn how to tap into that human capital, the Latino human capital, we're missing the boat. That, you know, that workforce is our future. And so we have to figure out a way to, you know, make sure that we are removing barriers. And really, this is, let me just be clear, this is not about lowering standards, which might be the narrative in some places. That is not what this is at all. You know, you heard Alfredo, he's a very talented individual. I mean, if you had the ability to work through a situation where you have to help your family by contributing and being part of the workforce early in your career, and you can still figure out how to get out there and get this kind of education and become a physician, you more than deserve to be there. And so this program, More Doctors for California, is really about addressing those systemic problems. And it's really not just, you know, solving that gap, but it's also changing lives. It's careers for so many people that deserve them. And, you know, when you think about the investment in one of these individuals, it's not just the individual, it's generations, it's generational impact. And so I'm super excited to be able to share the news with you. And I'm grateful to the Latino Coalition for Healthy California for taking this on. And, you know, with that, I would love to introduce you to my really good friend and former colleague, Elisa Ko, who's Vice President of External Affairs for HealthNet, so that she can share a little bit about how HealthNet is continuing to support this very vital work. So, Elisa, please join us.
Thank you, Martha. It was a pleasure to continue to work with you, but work with you in a more intimate level when you were here at HealthNet. And thank you so much for your vision, your leadership, your friendship, your mentorship. But like Martha said, This was really a brainchild of her and Dr. Hector Flores, and really excited to show and have next the campaign video for more doctors for California. At HealthNet, we're one of the largest Medicaid health plans, commercial health plans in California, and we really believe in everything folks on this panel were talking about, investing in our healthcare workforce. It is essential, right? More Californians need care than ever before, but there aren't enough doctors, nurses, or healthcare workers to meet that demand. More Doctors for California campaign is due to the work of so many people on this panel, Bede, Angela, others, right? Everybody in the room. And Martha really spoke to the amount of time and dedication they've done throughout the decades, and then specifically recently to make sure that we had this roadmap to make sure we're growing the Latine and workforce for the underrepresented communities. And we know this work is important. It matters. I know Alfredo, Maria, and others on this panel talked about the importance of getting care from someone who understands your culture, your family. A story so many of us on this call, on this Zoom, know how it is important to our families to get that kind of care. And with the support of Centene Foundation, HealthNet, we invested more than $9 million to grow California's physician workforce, and a large went to LCHC. Partnerships with Latino Coalition for a Healthy California, and all of you are so important to continue this work to improve California's healthcare workforce, and ultimately improving the care for all of us and all of our communities in the room. So I'm excited to share with you this video, and please join us on this campaign. Sign up. It is important for all of us and the future of California. So with that, let's see the video.
We cannot wait 500 years for parity. The time is now. Latinos make up 40% of California's population, yet only 6% of physicians in California are Latino. This shortage hurts us all. Fewer doctors means longer waits and higher costs. For Latino families, the impact is clear. Care is delayed, appointments are hard to access, and too often, patients are denied the right to care in their own language. A barrier too often felt by Indigenous communities. This is a crisis for California and a crisis for Latino health. We need a health workforce that actually reflects our communities. That's why LCHC is launching More Doctors for California, a visionary policy campaign that will transform and expand the systems that shape our physician workforce. Community is joining hands with partners across the health and education sector, and together we're strengthening and protecting pathways for Latino students to become tomorrow's physicians. Because when doctors reflect our communities, healthcare gets better for everyone. Join us. Together, we can light the path toward a healthier, more just California.
Wonderful, wonderful. And with that, it is really my pleasure to bring us to the end of this conversation. I want to say thank you to HealthNet. I want to say thank you to Marta, to Angela, to Maria, to Elia, to Alfredo, and just say that it is really a pleasure to call you all colleagues and friends. Alfredo, we are here to support you. Please reach out to us. And I just want to say onward, juntos, siempre con corazón y resistencia. Thank you very much.
Thank you so much, Berenice. What a powerful group, leading some powerful and great work to ensure that we have more doctors in California and more Latino doctors at that. I want to quickly add that 3 years ago, we actually interviewed Alfredo here in Telemundo, and it's really awesome to see all the progress he's made. It's making me really proud to hear about all the stuff that he is doing, and we wish you the best of luck. And to move on, we have reached the end of our panels and conversation portions of the day. And now it's time to celebrate some amazing people for their leadership, contributions, and work to support Latino health equity in California. And now, well, I'm going to ask Doctora Seciah to join us in presenting some Latin Health Justice Awards. Ready whenever you are, Doctora.
Thank you so much, Jocelyn. What a beautiful day we've had together. Familia, each year at LCHC and our Policy Health Summit, we are honored to celebrate individuals who truly display such powerful leadership. Incredible leaders and partners who remind us what health equity in action looks like. These people and organizations roll up their sleeves, lift up our communities, and move us closer to a California where everyone has the chance to live healthy, dignified lives. So today, we're not just giving out awards, we're celebrating power, we're celebrating Corazón, and we're celebrating you. First up, and if you'll help me at home with some drum roll here, we have the incomparable Martha Santana Chin. Martha, your leadership is nothing short of trailblazing. As a founding leader of the More Doctors for California campaign, the first woman and the first Latina CEO of LA Care, your appointment is historic. Your leadership is historic. You are breaking barriers and setting a new standard for what transformational leadership looks like. Your vision and dedication have strengthened our collective fight to ensure every community has access to care. Thank you for leading with heart, strategy, and courage, all those superpowers, and for showing all of us what it means to move with purpose and with power. In a second, we'll get a chance to hear from Martha. Up next, drum roll. And you'll see here the pictures of the award that will be going out, and we'll be mailing these to you all. Up next, we want to celebrate the amazing Senator Jessie Arreguin. Senator, your leadership has been fearless and rooted in justice. Through your leadership as the author of SB 81, you've stood strong for healthcare as a human right and protected access to care for all Californians, especially in this critical moment. Your commitment to equity and compassion is the very definition of California Presente. Thank you for reminding us that courage in policy is courage for the people. Congratulations. Up next, and our third honoree, the Rose Family Creative Empowerment Center. Rose Family Center, your partnership has been nothing short of inspiring. Through your tremendous support of our Gen Z Visionary Youth Building Empowerment Program, CVIBE for short, at Luther Burbank High School, you've created a space where young people can dream big, lead boldly, and own their voice. You are helping nurture the next generation of change makers, the future doctors, advocates, and leaders of California's health justice movement. The future is bright and it's powered by our youth. Thank you. Okay, and for this last one, it is actually a surprise. So now we need a big drum roll. We have a true legend with us, and that's Dr. David Hayes-Bautista. I have to admit, I am your biggest fan, Dr. David Hayes-Bautista. Your life's work has transformed how California and the nation understand Latino health. You have boldly changed the narrative of our comunidad, showing the strength, resilience, and brilliance of our people. Through decades of research and advocacy, you've shown that data has a story, a powerful story at that. And that is one that's rooted in love, contribution, and power. Gracias for being a guiding light for generations of health equity leaders. Thank you for your commitment, not just through your professional journey, but your life. And we're so proud to honor you with the Legacy Awardee, and thank you for honoring us by being with us today. So with that, I would love to invite our 4 honorees today to join me on the screen, and we'll pass the mic to you to share 1 or 2 minutes with any words that you would like to share. Maybe we'll start with you, Senator Arreguín.
Well, I'm deeply honored to receive this award by the Latino Coalition for Healthy California. I just want to thank LCHC for your partnership in helping write and pass SB 81. In addition to the broad coalition, including immigrants' rights advocates, our health facilities, including some of our major hospitals, labor, who came together recognizing that healthcare is a basic human right. No one should be afraid to go to a doctor because of their immigration status. And it's sad that we need this law in California. The escalation of racist ICE raids that are the presence of mass ICE agents in hospitals terrorizing communities is having a chilling effect on people accessing healthcare. But I believe this law is critical to make sure that healthcare spaces are safe spaces. And this would not have been possible if it wasn't the work of my amazing staff, Carmen Ayan and Luisa Mezcua, who work in my Senate office, who led this effort. And just really grateful for this recognition, and look forward to continue to work with you to not just protect our hospitals and health facilities and our immigrant communities, which are under attack, but to also protect healthcare access, which is also being threatened by the shutdown that's happening in Washington and the passage of HR 1. We know that we need to do everything we can to make sure that everyone in California has access to affordable and universal healthcare, and look forward to continue that fight with you in the months and years ahead. Thank you.
Beautiful. Thank you so much. Rocio, we'll go to you next.
Hi, good afternoon, everyone. Thank you. I really appreciate this award. The biggest thing for me is being able to support Angela in anything and everything that she does. What you guys do is important, and I'm just happy to be here to support the team. Thank you.
Thank you. Dr. Hayes-Bautista?
Well, thank you so much. I love your lema de Corazón de Resistencia, but we are the Latino GDP, and 100 years of deportations did not stop the Latino GDP. Creciendo, resistimos. Un siglo de deportaciones nunca nos detuvo. Let's go ahead. We can do it.
Así es. I love that energy. And wonderful. Let's invite you in, Martha.
Thank you. So, I gotta just first say that what an honor it is to be recognized on at the same time that Dr. Hayes-Bautista, Senator Arreguín, and Rocio are all here with me. I mean, what a good company that I'm in. And, it really is just a very incredible honor for me to be recognized. I really appreciate it. I want to just express my deepest gratitude to the Latino Coalition for a Healthy California. I mean, to be acknowledged by an organization that has long championed health equity for the Latin and Indigenous communities is profoundly meaningful. And we're living through very tough times, whether it's healthcare access or the immigration enforcement issues that are around us, or, whatever policy is going to drop tomorrow. And we all have to work together to make sure that we keep the long term in mind, much like those that led before us did. And, this moment isn't really about me. It's about us. It's about, all the generations of leaders who have advocated for our communities, for our members, and who have paved the way for us to really build on the foundation that they've laid. And it's about the families who we're fighting for to make sure that they have access to care, to dignity, to justice. And, the list goes on and on. And, the future that we build together really is about what we all say, we want, which is we want every single person, regardless of where they live, what the zip code is, to have opportunity, to have an opportunity to live a healthy life, and to know that they are supported by the village that we've all created. And so I am just deeply honored and grateful for the recognition, and I just look forward to walking shoulder to shoulder with all of you and locking arms to do what we got to do, which is, think about not just the today, but also the tomorrow.
Beautiful. Thank you so much. We really appreciate your leadership. Thank you for inspiring us every day. We'll pass it back to you, Jocelyn.
Thank you, doctora, y muchas felicidades a todos. Muy bien merecido. And thank you deeply for all of the work you do for our community. I hope that you continue with your great work and that you continue to help out our people. It's so good to see that there's so many people out there that are working for our people and that are working to protect them and keep them healthy. And now I want to turn back to Doctora Aquino for some final remarks to close out our day.
Wonderful. Wonderful. Thank you so much, Jocelyn. Appreciate you. And another round of applause for our honorees today. Thank you for all your hard work. Well, folks, we have spent a whole day together. Thank you for being with us today. We really appreciated sharing this space together. Thank you for interacting on the Padlet and sharing as your pictures as you're having your cafecito or lonche. Really appreciate having this time together to have these very important conversations. Just to think about where we've been today. I want you to know that everything about this summit is very intentional. From our summit panelists to our speakers, our presenters, to our author that shared the book during lunchtime. We wanted to make sure that every piece was connected to our greater theme and what we're hoping to leave with you, which is that encouragement, that reminder of your light inside you, that courage, the power of your voice, and the power of our joint unity in being that resistance against anything that our community is facing. When we think about panel 1, right, and those heartbreaking conversations that we had, what our community has faced day in and day out this year, but even before that, right, the fact that we have to be so resilient is hard, and it's a muscle that we have developed as a community. And we are doing everything we can, right, to transform the systems so that we can soar and continue to advance with dignity. And yet there are so many barriers that we still have to overcome. And so today we thank all of our panel 1 participants for holding down the fort, for having those really important conversations and really holding our community as this really hard work continues to happen. Then we moved to Dr. HB's presentation on the economy. And I want us to remember and act from that place of power as California. We are a global economy. Let's act like one. Let's be like France and Germany in creating a California that, regardless of who is sitting in the presidency, our California's health is safe. So let's develop a system of universal coverage where we actually center, and at the end of the day, when economic discussions or difficulties come up, that's not the first thing on the chopping block. We need to protect our most vulnerable. And we'll make it back. I know we will. We'll make it back to full scope. We will continue to push for that. And that actually leads me to our panel 2, right? We had our conversation about the importance of Medi-Cal, where we've been, the difficulties that we're facing, but that shared commitment that regardless of what field we're in, we know that as California, our shared value is health for all, regardless of immigration status. So let's continue to hold each other accountable in centering health for all as a value that we pursue, regardless of what difficulties come up, regardless of what decisions need to be made. Let's remind each other that we need to value everyone's life and do it with dignity. And then we move on to panel 3, right? Where we talked about the beauty of diversity in the workforce and the power of our lived experience, the superpowers that make us efficient, strategic, and beautiful, amazing leaders, be it in formal positions of power or informal. So I want to thank all of our panelists today for joining us, for having those important conversations. Thank you for everything that you do in your spheres of influence. It makes a huge difference. Let's continue to help each other. Let's continue to remain creative in how we're approaching solutions. Let's not just go back to what we know because we've been there. Let's transform, reimagine systems. Let's explore new revenue generating ideas so that, again, California can be the leader, continue to be that leader that centers health equity in everything that we do. With that, y con Corazón de Resistencia, standing strong with each and every one of you, I thank you from the bottom of my heart for joining us today. Muchísimas gracias.
Hoy en la mañana desperté llorando. Es que tuve un sueño y me dolió. Ay, tanto. Estabas tan bonita con el vestido blanco que una vez te regalé. Ibas caminando con aquel que un día puso en tus manos un papel que decía: amor, te quiero tanto y no soporto el llanto si no me das el sí. Y él se acercó, te quiso dar un beso, será por eso que Dios me despertó. Y fue un ángel que vino en un instante y ese sueño por suerte terminó.